Okay, good morning. Welcome. I'm going to go ahead and call the July 28, 2020 Lake County Board of Supervisors meeting to order. I want to welcome everybody, and we'll go ahead as usual and stand for a moment of silence. Do we have any dedications today for a moment of silence? Seeing none, we'll go ahead and stand. Supervisor Sabatier, would you lead us in the Pledge of Allegiance?
Yes. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Item number 4, consideration of extra items not appearing on the posted agenda. I think we have any, but I'll go ahead and read it. And that is correct?
Mr. Chair, none have been brought to my attention.
Okay, let me make sure. All right, number 5, approval of consent agenda. Consent agenda items are usually non-controversial. Everyone passed, so I do know that there is one item that needs to be pulled today. Carol, I don't know if you want to pull that or just pull it as a board.
Director De Leon is in the room and may want to comment, but yes, we're pulling that for a future date.
Okay, are there any other, all right, so are there any items that need to be pulled from the board? No, any items from the public or directors? We're gonna go ahead and pull, I got the email, we're gonna pull item 5.2.
Mr. Chair,
Yes,
this is Anita. If I may, it's not going to be pulled for a future date. It's just pulled.
okay, it's just pulled.
It's just incorrect.
Okay. Thank you. So we're gonna pull item 5.2. Again, I asked from the public if there was anybody from the public who wanted to pull anything. Jake, can you open the room?
Yes, I will unmute the floor here. All right, the floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, hearing none, go ahead and bring it back to the board. Supervisor Sabatier, I forgot to ask, is there anyone in the boardroom at this point?
Currently, there are no public members in the boardroom, therefore no one from the public wishes to pull any item.
Thank you very much. We'll go ahead and bring it back to the board for action.
Mr. Chair, I move to approve item 5.1 and item 5.3 to 5.9.
Second.
There's a motion and a second. Can you please do the roll call vote, Johanna?
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott, Supervisor Brown, Supervisor Brown,
I think your microphone's on.
and
on.
Supervisor Simon.
It's on.
Yes.
Okay, there we go. Thank you. Aye.
Thank you.
Okay. Thank you very much. Moving along to item 6.1, public input. Do we have any public input today? I don't have any in my thing. Carol, were there any written?
None has come to my attention in electronic form.
Okay. Thank you very much. We'll go ahead and open the room, see if there's anyone with public input.
All right. So yeah, I'll mute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close the room up and bring it back.
Okay.
Thank you very much. Okay, we'll move to item 6.2, our 9:02 a.m. item. And we are on time, so we'll go ahead and go to consideration of an update of COVID-19. Dr. Pace, welcome.
Good morning. Thank you. You can hear me? Yeah. Okay.
Yes.
So good morning, Mr. Chair, supervisors. Thank you. Gary Pace, Public Health Officer for the county. And the update for today is, I'll try to keep it brief. We're now at 175 cases. Only 12 are active at this point. One is in the hospital, which is out of the county. So there's nobody hospitalized in county at this point with COVID. This is basically, we're at a similar place as we've been the last few weeks, where we have new cases daily, some kind of close calls with some outbreaks, but they've not been, spread widely. And now we're not getting into any kind of explosive rises or overwhelming of the hospital facilities, but the community and businesses and everybody are kind of having to deal with this on a daily basis right now, but it's reasonably manageable. In the surrounding areas, we're seeing a rise in cases throughout California, really, with increase in hospitalizations and deaths. At this point, there are a total of 8,500 deaths in California that were COVID related since the beginning, and it's approximately 100 a day right now. People are dying in California due to COVID-related causes. There's some suggestion that this curve, the elevation in the curve in California may be flattening out right now, but it's very early in it, and so we'll have to see. The governor's been doing a lot of action to try to get things under control by adding restrictions in the places where there's a lot of cases, but it takes several weeks to really see if they're having the desired effect, and we may be getting the early hints that they are starting to work, but the hospitalizations and the deaths continue to rise at this point. Sonoma County is also in a difficult situation where they're having a rise in hospitalizations. They had, I think, 46 COVID-related hospitalizations on Sunday. Most of these are being driven by some outbreaks in the nursing facilities. There's a couple different nursing facilities that have outbreaks, and that's where a lot of these hospitalizations are coming from. There's a similar situation in Mendocino County where they've had a rise in cases, and they've got a nursing facility outbreak as well. So to look at our variance data, we're still doing okay with that. We're kind of at the borderline between to tip over into needing to go on the watch list, but we're not there yet. We continue to kind of ride under the level a little bit. Our current positivity rate for testing is 4.4%, which is pretty good. 8 or higher is kind of a problem, so we're doing okay with that. So at this point, Lake County is not on the watch list. Mendo, Napa, Yolo, Solano, Sonoma are all on the watch list. And one thing that's important is once you get on the watch list, you stay on until the state makes some determination that they're going to change things. So it's kind of like we can stay in this status of off the watch list until the switch flips, and then once we go on, everybody that's on it sort of travels together. Even if things improve, you don't get off it at this point. That may change down the road, but that's kind of the current strategy. So to talk a little bit about the response capabilities in the county, one thing that's important to say is the state did check in with us, and we did have to confirm that we are still meeting all our variance metrics, which is one of the things, most of them we're doing really well with, but they did kind of check in with us and make sure that we were still on track. The testing strategies are going okay. The Verily site is continuing to function. Some people get into some challenges getting on the site and getting appointments, but it is working, and so I encourage them to try it again. If they're not able to get through, to call us at the Mohawk phone number, and we'll help you do it. But the state looks like they're going to fund it at least through August and potentially longer. We are working on trying to create some other plans and trying to kind of find some funding sources to support it past August if the state does withdraw the help. UCSF is the site we're using to process other samples that aren't going through the Verily site, and they're doing that for free at this point, and that's functioning reasonably well, and so that's going to go at least through the end of August as well. So far so good. We did get some volunteer help from the community and also from some of the other departments, and we really appreciate that. And Verily has provided one clinical staff to help us, which is helping quite a bit. On the housing front, so this is all part of the kind of the county response. The housing front, we have some hotels, sites that we're using that are working reasonably well, and I think the whole homeless situation will be talked about a little later today because the current agreement runs out by the end of the week. We do have an agency that's interested in continuing the services forward, and and I think that's on the agenda today for you all to talk about. But that's kind of an essential piece in all of this to keep that going. It's basically it needs to serve as a bridge until the Hope Center opens up. Either end of September or October is what they're hoping for. There is a whole issue going on now with the state prisons because there's some outbreaks in several different prisons. For instance, San Quentin, approximately a third of the inmates have tested positive, and one of the state strategies is to go ahead and try to get some of these folks out of prison and out of the confinement so that to try to decompress things a bit. So they're sending out thousands of people over this month, and some of those folks are coming back into the county. There have been a few that have been either exposed and within their quarantine period or positive, and but we've been working with them about keeping them isolated. So it's been a little bit of a struggle, but with the help of the sheriff and with Rob Howe and the probation parole, we've been able to manage so far, and it's a kind of an ongoing issue, and I think this will be going on for a while. The contact tracing is going well. We've gotten some volunteers now, again, from some of the departments and from the community, and we've also gotten some help from the state with that, with the 4 contact tracers coming in from them. So we are able to keep up with the cases at this point, and that's a good thing. So we're kind of tracking everybody as best we can. The general patterns that we're finding with the contact tracing and the case investigation is that it seems like for the most part in Lake County, people are either getting positive by some family member or somebody from out of county visiting, or them visiting out of county, and then there's a confirmed case that they had contact with. But there's also some other situations. Social gatherings continue to be a big issue, so we're really encouraging people to decrease that. Where any of these kind of social events where you have multifamily gatherings coming together, especially if they're indoors, is a real problem, and that's where we're seeing quite a bit of spread. There has been a case or two that's shown up now in a bar where somebody was at a bar and not masked, and that's where it appears that they got it from. The other main thing is frontline workers, so farm workers, food service workers, healthcare workers, those folks that are in the public seem to be at a higher risk of transmission and getting sick. This is one of the big approaches that the state now is interested in, is trying to protect these people more and have ways for them to take off work if they're starting to be sick, rather than going back into work because they don't have much sick time and things like that. So it's just useful for us to be aware of the patterns that are unfolding. So in terms of talking about the reopening and the staying open, we're really, the state, and I think the state is really taking a two-pronged approach right now. The governor came out again at the end of last week with a fairly lengthy discussion about this, but really they're interested in educating people on how to slow things down, and they're starting to put some compliance teeth into the whole process. The thinking is that we're starting to really understand better some of the ways that we can prevent spread and flatten the curve. We saw it before when we shut everything down, and now we're starting to get a little better about being a little more surgical about some of the things that do seem to work better than others. And it seems like education and really trying to get people on board is the main focus now, and then to have some compliance teeth in it. They do have some state kind of SWAT teams that are going around to the counties that are having problems with ABC investigators and restaurant investigators and OSHA. Those seem to be the three ones that will go around to counties that don't seem to be in following the rules quite the way they want, and then they'll go in and start visiting some of these businesses. The other thing is that there is some suggestion that the governor may withhold some of the funding that's coming down from the CARES Act if counties are seen as not in compliance. I think from our point of view, the big thing that we're wanting to encourage is for folks to take the actions that they can take so that we can stay off of the watch list. We're kind of in a unique position around the state, really, because we're kind of one of the borderland counties where pretty much everybody south of us now is on the watch list, and most people north of us are not. So we're kind of the next front. And hopefully because of our isolation and because of the way people are trying to adhere to things, we're going to be able to avoid it. But once you're on it, you're on it, and we lose a lot of local control. Once we're off it, we have a lot more flexibility and ability to make decisions, and sort of we're not under the same level of scrutiny as the folks that are on the watch list. So we're really trying to encourage everybody to see this as an opportunity to, if we basically really step up and do as much as possible right now, we might be able to continue to avoid going on it, because the momentum's kind of that we would tend to go that way. But the more actions we can take to avoid getting on it, I think the better off we'll be. The businesses now are basically, we're at the state where the indoor restaurants are closed, the bars are closed, the brew pubs and wine tasting rooms can do outdoor businesses, as can the restaurants. And I see around the area that a lot of places are starting to adapt to this and trying to have more outdoor businesses, and that's a great thing. The next step is what's done when you get on the watch list, and that's closing some of the indoor services in other types of businesses like hair salons, nail salons, things like that. The schools now are really in a deep discussion about how to move forward. You know, it's kind of confusing lay of the land out there right now. The federal government is really pushing for schools to open. The state is basically saying that if you're on the watch list, you cannot open. But if you're not on the watch list, you can open if you feel like you can do it safely. And they have a lot of recommendations about masking and social distancing and stuff. Each of the school boards in the county is working on this right now and trying to determine what opening dates are and how to open. And I think that's probably out in the public now, but just to acknowledge that it's a very challenging decision to make in terms of keeping the teachers safe and keeping the kids and the families safe, and also trying to get good educational opportunities for the kids and social development. Again, when we go on the watch list, any choice around that goes away with a few exceptions, but generally at this point, we do still have local control over how to do that. So, you know, I mean, I think basically we are in a similar state as we were last week. The counties around us are somewhat worsening, but there's the hint that they may be flattening the curve now because of all the restrictions that have been placed. And we're really hoping people can take the steps needed, which is masking, keeping social distancing, and avoiding social gatherings. Those are the three main things that we're really encouraging people to do to help us keep the level at where it's at now and avoid going on the watch list, and thus being able to keep more local control. So I think that's it for now. Thank you.
Thank you, Dr. Pace. Go ahead and ask supervisors. Any Supervisor Sabatier?
Yes, thank you very much for that update. I had a few questions. One is for the watch list. I believe that I've heard and was told that if you are on the watch list for 3 days, then you have to take action. Is there still that 3-day waiting period to make sure that you remain on the watch list?
Right. The process of getting on is they'll look at the data, and there's a 3-day period, and during that time you're in conversation with the state. So so there's an opportunity to sort of explain what's going on, or if there's a unusual burst of data that can be explained. They seem to be pretty open to that. So yes.
Okay, so that's good. You gave us the positivity rate. We're at 4.4% is what you stated, with the 8% being the threshold where the state starts to raise a flag and wants to have further conversations. I know that one of the ones you were worried about last week was our number of cases, I believe, in the last 14 days, which I think is 100 per 100,000, 100 cases per 100,000 people. Where are we at currently for that stat?
Yeah, we're staying in the one I saw this morning was 60.
Okay.
So we're below the line and doing pretty good. What will happen for us is if we can stay like this, we'll be okay. But if we get an outbreak, it's going to push us over. And so I think if we get a brief outbreak, we would come back down. But the pattern that we're seeing in some of the other counties is you get a couple of outbreaks. But at this point, we're still below the line with a little bit of wiggle room.
So we're at about 60% or whatever of the threshold for both of those, definitely above the 50%. And like you said, we're a small county, so a small rise impacts those percentages pretty quickly. What I was also wondering about was the number of tests, because it looked like when I looked at the hub last night, that we seem to be below I think the threshold is 150, whatever the per capita is, or whatever the threshold is, and we seem to be below that. Has there been any conversations on that with the state? Is that something that you're anticipating will be rectified, and we'll see new updates to that will increase the number? Is that something we should be worried about?
If you watch, it kind of goes up and down. We go somewhere between 120 and 170, and there doesn't seem to be any particular concern at that from the state at this point. We have adequate testing capacity. It's not ideal, but we're definitely adequate, and people can get tested. I mean, partly because we have our nurse practitioner who basically deals with any cases that we need off to the side that can't get in the regular way. So Lynn is working pretty hard on the side to get everybody in. So I don't really foresee that as being a big issue. They've not brought that up at all. And like I say, we go up and down. There's a variation. I think it partly depends on how full the testing site is that day, how many people are coming from out of county, because we don't get credit for the out of county folks, and other testing things that we put together. So, that doesn't seem to be a particular. That's something that we're doing a decent job with, so I think we're okay right now.
Okay, perfect. And then I was curious about right now we're at 12 active cases, which is actually not bad. I think last time we were at 12 was back in late June. Is our active cases low right now because they're low, or is it because it's taking so long to get the results on testing? I got tested 14, 15 days ago. I still don't have my result. And so I'm wondering if the 12 active is due to a lag, or if it's somewhat within the normal range that we should be expecting.
Well, you haven't gotten your results from 2 weeks ago?
Nope.
Through the Verily site?
I have an email over the weekend saying we are behind. If you want to try and figure out what the response is, here's a different way to get access. But that access is basically saying we don't have your results yet. And I just think
that was through the Verily site?
That was through the Verily site, yes.
All right. Well, let me get somebody working on that. So it's, cause that's.
Yeah, my appointment was on the 13th of July. And I just think that doesn't do us any favors. It's great that we can stay up on the threshold from the state, and you said that doesn't seem to be a problem. But how useful is any of that information if it's 2 weeks or more after the test results? And because I'm seeing the actives go down, but I'm seeing the cases go up, and I'm just kind of wanting to ask if...
Well, right. If you come back positive, you will never make it on the chart as an active case. I haven't heard of any that far out. I was aware of kind of 7, 8, 9 days sometimes, but right. If you're positive now, if it's 14 days, you're already off quarantine. So, so you would never make it on the active. You would make it on the total cases, but you won't make it on the active cases.
Right.
So I think that's probably partly what's going on there. Is we continue to have, a handful of positive cases every day. But I haven't been aware of getting any that were already completely through the period.
And so just real quick, based on the data that I'm seeing on the hub, and I'm just going with the cases, which is the easiest one to say that we're definitely 100% on what that is. In the last 7 days, it looks like we've had 19 cases. In the last 14 days, 53. So in the past week, it looks like we've been doing a little bit better on our case rates. And so it looks to me like if we can keep that trend going, let's keep it going. And also, you mentioned a phone number to help out with the testing, and I'm just wondering if, again, anytime that we have the opportunity to, is to share that phone number, and also what the testing schedule is. And I am done with all my questions, and I appreciate the update. Thank you.
Yeah.
Supervisor Scott?
Okay, so I'm a little confused now then about the active cases. So to get off the active cases chart, you don't have to test negative. You just have to go past your 14 days. Is that correct?
Right. The way this works is we don't test at the end to make sure somebody tests negative. There's a time-based strategy that's put out by the CDC, so we didn't make this up. And it's so from the time you get symptoms, it's 10 days after that you are considered no longer contagious. And so this is important for workplaces, because if their employee tests positive, 10 days later they can go back to work without any restrictions. They're not considered contagious at that point. The CDC has done a fair amount of research on this, and sometimes people still test positive at the end of the time, but those viruses don't grow. They're not able to grow them in culture, so that they're not considered infectious. But so it's dead virus that gets picked up. So there's no real advantage in testing at the end. So we don't recommend that. We basically just are recommending the time-based strategy.
Thank you. Yes, I was just assuming, I guess, people were getting retested to take off that. So thank you for clarifying that.
Supervisor Brown?
So then I'm really confused then, because we just got today in Lakeco News was talking about, I think, 24 new cases as of yesterday. So those tests are anticipated to be negative before we even hear about them?
I was getting the numbers off of the hub this morning, was what I was reporting to you, so it may not have been updated yet.
We're having more than 12 new cases each day or every other day, and so if our positive cases are going down while we're getting more positive cases, then maybe we need more positive cases so they'll go down quicker based on that method.
I think what this is a data question that basically, from the data I was reporting is from the website from yesterday. So, and that's updated daily. So if we talk at the end of the day, and I can update you if that's important, it's,
Well, okay, no, and it's not. It doesn't make sense. So that's why it's almost like, why are we giving out the statistics if they're wrong before we even give them out? Because it's always just a snapshot, and we don't know what's going on at any given time. And that's the way this whole thing's been, not at the county level, but state level and national level. It's just the numbers are so skewed and inaccurate, and they could be inaccurate in either way. There could be more cases. I don't know, because the information that we're getting is so skewed. We're talking about, we started talking about COVID-related deaths, and then that shifted to COVID-caused deaths. And we know that we've had one death in Lake County who tested positive after the person died. Now, all of a sudden, that's in a category of COVID-caused deaths and with no autopsy. So I don't know. I'm not trying to debate anybody or anything. I'm just trying to, justify why I'm not warm and fuzzy with the information that we get, because the information is just so outdated minutes after we get it, or hours before we get it. So it's not. It's a strange dynamic how these numbers are working. We have. I just pulled this out where it said, we increased 175 cases.
No,
this was on Monday.
We went to 175.
What's that?
We didn't increase 175. We reached 175 total.
I just said it increased to 175. Or maybe if I didn't say that's what I meant.
Yeah.
We increased to 175, and that was up from 168 on Friday, and 12 are active. So, but we went up that many cases, and I know that farther down the line there was something about. There was maybe another article about gender, and it talked about that, and it just doesn't seem relevant to a lot of stuff. It's not. It's inaccurate, but not intentional on your part. I get that. It's just it's inaccurate from the minute we get it. So.
Okay, Dr. Pace, I don't know if you have a response or.
Well, I mean, it seems like part of what you're sort of pointing to is the confusing nature of the data, and basically, I don't know whether, there are trends, we're watching them, we're trying to base things on this very imperfect science. We're watching the counties around us, there's people, I'm not sure exactly what.
I'm not trying to be critical of you personally.
But other than, we are reporting what we get. There's a time lag.
Yeah.
You can dissect it easily and point out the inconsistencies.
Well, you can't dissect it easily because the information has to be accurate in order for you to accurately dissect it. And it's what it is. If we go up 20 cases in 2 days and our active cases go down, that doesn't make a whole lot of sense. And then, then we hear about, I'm not sure if this is an isolated incident or if this happens all the time where tests are given and then, a week or 2 weeks later, we still don't have them. And then those cases, it comes in positive, but the person's been negative for a week, then, it's a mess trying to keep up with all this stuff. And then, it is imperfect, but it's also imperfect when we're creating strategies and plans on the same kind of imperfect model that has not worked and has not been accurate at all, not even close to being accurate. But that we as a state are considering sanctions against businesses that aren't causing the spread when the spread is coming from other areas. It's very frustrating.
Supervisor Sabatier?
And if I may, and I think that I'm going to agree with the frustration in the sense that all of us are limited on what we're receiving because we don't control the labs. And if we can get the labs as quickly as possible, then we'd have definitely much more specific data on what's happening today. And I think and I'm going to put words in Supervisor Brown's mouth, that this is not related to what public health is doing, but it's related on, we're all waiting on data that's coming to us from the outside, and it's not the data that we're creating on our own, and it makes it really difficult, and we're always doing our best to try and figure out what to do today for tomorrow based on that data that we're receiving.
I do have one other question, Dr. Pace. Are you getting any, and I know a lot of it's social media, bizarre nonsense that goes on with that, but some of it is accurate, that there are some cases, some instances where people are contacted saying that they've tested positive and they haven't even had a test done. So I know for a fact that that's happened to a friend of mine and their 4-year-old daughter. They had her social security number, everything. They called from the health clinic in Colorado that they had visited a couple of weeks ago, and she never even had a test, but they said that she'd come back positive. So is that very isolated, or are you getting any reports about that? I talked to Lynn about that. I did pass that on to her, but I haven't heard anything like that in Lake County, but
yeah, I heard about that one. What's happening in Lake County is it's a very high touch approach that we're doing to trying to control things here. So, your points about the data are always good, and I can't really, this is my life trying to figure out how to make decisions and to do things based on this imperfect data and time lapse, like Supervisor Sabatier is saying. But what we do with this is we take a very high human touch approach, which is the nurses will call everybody that we get a positive result on and talk with them about it. And some of them don't live in the county, so we switch it to the county they live in. Some of them, the story doesn't make sense, and then we have to kind of really investigate and get to it. And then we start talking to them about all the people they've been in touch with. And some people, of course, don't want to talk to us, and they're upset, and they feel like it's an intrusion, and we have to kind of work with that. But, it's not just, these people are not just a data point to us. They're human beings, neighbors that we contact and try to work with and try to help them understand what's going on and how long they're going to be in isolation and quarantine for, how to protect their family. It's a very in-depth, multi-hour process, really, with all the things. That's why I've been asking for help, and I really appreciate that we've been getting the help, because it just takes so many people and so many human hours to do this. So I know that's probably not exactly what you were asking, but we're not, when we do find anything that doesn't match up, and occasionally stuff like that does come up, then, we deal with it. It's a imperfect system, but we're basically at this point, we're able to investigate all of them that are coming our way.
Got it. Thank you.
Supervisor Crandall?
Yes, Dr. Pace, since certain tests are taking this long, and I remember, a couple weeks back when some folks were taking tests, I think we talked about this as well. They were saying that no news is better news. But even if the test comes back, and it says positive and they're already up to the 14 days, isn't that when this IgG or IgM test would come in handy? Because I know they're giving that out in different areas, but this would show the antibodies to it. Apparently those tests show the antibodies to it. And so wouldn't that make sense to start, after people take those tests, and even if they've recovered, then take that IgG and IgM test?
Well, that's the whole antibody testing still has yet to be sorted out, how to use that from a clinical point of view. The problem is what's being pointed at here over and over again is that there's just so many tests going through at the state level that they're having bottlenecks, and so we're not getting the results in a timely fashion that we find that are particularly useful. We have zero control over that at this point. The antibody test is very variable. There's a lot of different machines. It's not clear exactly. There was a big article, I can send you, there's a big article in I think it was in the New York Times yesterday, about the antibody testing and just some of the variability and some of the problems with it. You know, from a clinical point of view, we just have not figured out how to use it in a way that's helpful. Even if you get a positive, does that mean you have enough antibodies to actually protect you? We don't really know a lot of that at this point. It's just too early in the process, and the tests are imperfect now. So, I mean, what we're really using is these PCR, the viral tests, and there's just the demand has outstripped our ability to do it, which is extremely unfortunate now that we're seeing this rise in cases around us, because this is when we really need the tests. And so, you know, extremely frustrating from where I sit.
Well, and plus the other thing is even if someone is infected and they recover, they could still get reinfected. I know one of the cases in my area, they caught it at least 3 weeks back and still have it. And so, or have been reinfected or something, you know. And so I think the fact that there's nothing to curb it, you know, or from you know, a repeat case, I think that's the other thing to be concerned about.
Okay. Supervisor Sabatier?
Yes, thank you. I had one more question I didn't think about when Dr. Pace was giving us his update. Do you have an update, Dr. Pace, on the recruiting of an epidemiologist?
Yeah, right. I felt the need for an epidemiologist up here with me today. So, yeah, I think the contract got signed yesterday, so she's going to be starting soon. I mean, what we're starting with is something like a half a day a week, but you know, if I'm hoping we can entice her into more, and there looks like we're trying to pursue some state funding for it. So yeah, you know, we could definitely use an epidemiologist. I mean, we don't have the professional staff that we need to do some of what you're asking, but she's going to start soon.
That's good. That's good news to hear that could have been.
They have several
yesterday.
of them on Facebook that'll do it for free.
And then, real quick, just to get a yes or no answer from you. So what we're looking at right now is potentially 1 to 2 weeks old data because of the fact that people got tested and it took 1 to 2 weeks to get completed. And then it's 1 to 2 weeks of activity that those people took part in that got them got them into a positive situation, because it takes that long also for the symptoms or anything to start showing up. Am I correct? So that we're about 3 weeks behind what the actuality is as far as what our numbers are showing?
I'm not sure I quite understood that. Basically, if you have contact with somebody, you should show symptoms within 14 days of that contact. If you test during that time, if you've got the virus growing at an adequate level, you'll test positive. At the end of the 14 days, it's still possible to test positive, but if you've not had any other contact, you're not considered infectious. So in terms of, if you're asking about the data of the active cases, if you haven't gotten your results in 2 weeks, that's a mess. That completely, you will never show up on our active case, you know, numbers. You will show up as a total case, but not as an active case, right? Because by the time you get the results, you're no longer active.
And just for clarification, because I think we do agree, because it takes 2 weeks for those symptoms to show and for you to test positive, and because it takes at least 1 week for the tests to come back, we are looking at data that kind of gives us a picture of what happened 3 weeks ago. Because those were the activities that those people.
I see. Because right. Yeah. Exactly.
Okay.
Mm-hmm.
Thank you.
Okay.
So if I get tested, according to what Supervisor Sabatier is saying, and you're saying too, Dr. Pace, and what's happening, and I get tested and I don't really realize that I have it. I just think I do, and I haven't got the numbers back, and it's past the 14 days, and I'm not counted as an active case. Even though I did test positive for COVID, and I've been out and about to different places, there's potential for me to spread still. that I think that's what scares me the most. I don't say scares me. It just kind of concerns me the most is that either it gives some of this, even with the tests being the way they are, or even the situation that we're in, because I'm looking around us and I'm like, at least glad that we're where we're at compared to surrounding counties and surrounding situations. But it gives the impression that it's not really affecting us, or there's some sort of community. And so our community tends to get lax, and then there's that potential for spread. And I'm pretty sure that, and I know that some people that have caught it and they're recovered and they're doing really good. But there's others that wouldn't survive that. And I know that because there's surrounding areas like Mendocino where I know some active cases where the elderly have passed from it. Of course, the elderly have also survived. But I just think that that's a thing to be concerned about. So it does concern me about the test situation, because it kind of it still makes it a conundrum, if that makes any sense, because you're not really knowing with the data, but then there's still all this potential for spread, and it kind of gives like almost a false impression if you can have those 14 days. I don't know. It's kind of speaking out of my mind.
Well, this is part of why we really encourage the use of masking and the social distancing, because, right, if Supervisor Sabatier's test comes back positive, whatever he did in the last 14 days, he's probably been spreading it. So, but he unknowingly. And so that's partly why we just have to try to do these. And, I'm not sure the testing situation is going to change a whole lot in the immediate future.
Thank you, Dr. Pace. I think, obviously, thank you very much for the update. It is changing on a daily basis. But once again, I think the one thing that we do know that we do have control of, at least this point as an individual, if you have an opportunity, is like you hit the 3 points is, wear your mask, assume it's everywhere, social distance, no large family gatherings between separate households, and at least move down that path. Those are things we can control. I do agree with you with the testing. It seems like it is being overwhelmed at this point, being pushed out longer and longer. So then it goes back to just trying to consider what we have control of, which is individual decisions. And ultimately we know there's folks out there that can't wear a mask, but then there's opportunities for social distancing. So we just continue down that path. I want to thank everybody in our community for doing what they are doing at this point, because it seems to be moving in the right direction. We don't know that 100% for sure, but we'll see that over the next 4 weeks. And I want to thank everybody in the health department, Dr. Pace, all your folks, Denise, all the volunteers and everybody for the hard work that they're doing at this point. Glad to see that got some help. We'll hopefully that will help from there. And obviously for Supervisor Sabatier and the rest of us with the data, the epidemiologist coming on board here will hopefully be able to do some local data stuff that we can really rely upon instead of waiting for the outside to bring the information to us. So greatly appreciate it. Those are my comments for today. Are there any more comments from the board? Okay, kind of at the same time. So we'll go Supervisor Brown and then Supervisor Sabatier.
Supervisor Brown? Did you raise your hand? I guess he didn't raise his hand.
Okay, sorry about that. Supervisor Sabatier.
Yes, I was just again asking Dr. Pace if he can give us the schedule for the test sites, how to get an appointment on those test sites, both the website and the phone number, if that's possible.
Right, thanks. So the phone number is 263-8174, 263-8174, or you can email at MHOAC, MHOAC, at lakecountyca.gov. And the schedule now is Mondays and Tuesdays in Clear Lake, Thursdays and Fridays in Lakeport, and then every other Wednesday it alternates between Middletown and Upper Lake. And I think the hours are 8 to 12 now because of the heat.
Yes.
And people are still able to get appointments. It's, sometimes they fill up, and there's sometimes can be a little bit of a challenge. So if you try to get on online and you make an appointment, that's the easiest way. If that doesn't work, just call our number and we'll help you navigate it.
And what is the website for the appointments online?
I think it's I don't know. I always just go to our website. Is it Baseline? Do you know? You probably know.
I know it's Project Baseline.
It's Project Baseline.
Yeah.
Yeah.
Project Baseline.
Is it .com?
And just for, this week, the
Yeah.
testing on Wednesday is at the Lions Club in Middletown. They're in Middletown this week. In Verily, correct?
I believe so.
Yes.
And it's projectbaseline.com, and it's fairly simple to go through and sign in.
Okay. If there are no more questions from the board, we'll go ahead and open it up to public comment. And I see we do have 2 hands up at this point. Jake, can you take us through the hands?
Yes, all right. So the first hand we have up here is from Michael Green. Michael Green, I have a mute request. Will you give me a sound check and confirm your first and last name?
Yeah, thank you. Hi, Michael Green. Just wanted to share my own testing experiences. Most recently, I tested June 25th. I didn't get any results back for 3 weeks. I did not easily find who I was supposed to contact at Project Baseline, but I did find an email. Emailed them on July 18th. Waited another week, got an email back Saturday saying my results were still being processed and to hang in there. In the meantime, I had reached out to public health, and I forget who I talked to, one of your public health nurses. Apparently you have access to the state database, so they were able to look me up, find the test I had done on June 25th, confirm that it had been negative, but it's still not popping up in the results page in Project Baseline. I'm unable to schedule another test through the website. I did reach out to the phone number with somebody who was going to help me schedule that. And I'm not dissing anybody. I know they're busy, but I haven't heard back. So I just want to reinforce that if other people are having significant testing delays, that is a problem. Because I'm glad to find out about the negative a month after it happened, but it is pretty much useless. So I guess one question is, how widespread is this? What kind of monitoring are we doing, not just to see how well the tests are being conducted on the front end, but how timely we're getting results on the back end? And then if there are these substantial delays in processing the tests and getting the results back, is the metric with the state variance just we're doing the tests and that's good enough? Or is it that we're getting tests and getting results back timely enough that we can take intelligent decisions based on those testing numbers? It seems to me we may be meeting the variance on the raw number of tests, but it seems like we are way behind the 8 ball on getting any actionable information from those tests. Thank you.
Dr. Pace, I don't know if you want to respond to that.
Sure, I can respond. Right, well, that's a bad situation. I'm sorry. It looks like we're going to have to, I haven't been hearing this level of delay and concern. And so again, we don't really have very much control over this. This is through the state and regional labs that's where the backup is. The results the samples are getting down there. It's just, but we will look into it and see what we can do. I think the question about the variance is, what they were testing was whether the county is providing access to testing. And that's what we have control over. We really don't, we don't have a county lab. If we did, this could be a different discussion. We would have some control over it. That requires an investment in infrastructure that, hasn't been done. Sonoma County has a county lab and they have some ability to impact things. What the variance is testing is measuring is our ability to sample people. Now, is that really the solution to the problem? Obviously not. You didn't get anything useful. This is more at the state capacity level, and they're not really. So we'll have to look into that. And you point out a really important discrepancy in what we're providing and what's actually useful and actionable.
Real quick, Dr. Pace, if I could just ask this in between, because you said something that sparked it. We don't have a county lab like how Sonoma has, and that's what you're saying, right, Dr. Pace?
Correct.
And with possible resources from the CARES Act funding, is this something that we could do so that way we could get a better hold on this, since they're asking for these numbers and making sure that we're, keeping good track of this? Do you think it's something that's possible?
Well, I think there's, that's a big question. I don't know if you want to go into that here, but it's certainly something we're talking about, is how to try to improve capacity here for the long haul. And, possibly one of the ways would be to connect in with the Sonoma County lab. That's what's been done in the past, but, it's been a funding issue. And now we do have some money for at least a while that we could put towards this. And one possibility would be to use a structure that's already in place, which is the Sonoma County lab. I think that's a big discussion here. And it's part of the large discussion about whole public health infrastructure funding, where, how do you want to address that and what's happening at the local and the state levels. So,
it's something we could probably talk in the COVID recovery or another form. I know what you're saying. Thank you for answering, Dr. Pace.
Thank you, Dr. Pace. Thank you, Supervisor Crandall. Go ahead, Jake, if we could get the next hand that's up here.
All right, the next hand we have up, looks like this is from Haji Wharf. Haji, I've sent you an unmute request. Looks like you're unmuted. Will you please confirm by stating your first and last name?
Thank you. My name is Haji Wharf. I live in Upper Lake. Good morning, Dr. Pace, Board. If our goal is to minimize exposure, keep numbers of cases low, and avoid being put on the state monitoring list, why is Upper Lake School District the only one in Lake County, and as far as I know, in the region, including Sonoma, Napa, Mendocino, our surrounding counties, the only one in the area being allowed to take undue risk by starting the school year with in-person classes? If large gatherings of 10 or more people are responsible for much of the virus spread, and we're actively discouraging that, then why are we subjecting children and teachers and staff and the larger community to this exposure? I don't understand why there's no oversight on that decision. I understand there was a survey sent to families, but I feel like the interest of the public health supersedes that of anxious parents. So that's my question. Who's going to be held responsible when the current number of cases is 8 in Upper Lake, spikes to 80? And when do they reassess? At what point?
I think really the question, Haji. Dr. Pace, I don't know if you want to just give background information on that, but ultimately the school district superintendents, they're the ones who make the decisions on that in coordination with public health, correct?
Correct. Yeah, that's a important topic that's been discussed at length, and a lot of people are struggling with how to move forward with the schools. And under the current state guidelines, if we're not on the watch list, then the schools can open. And since we're not on the watch list, the schools have the ability to open. I think there's been a lot of concern because the distance learning that happened this spring probably didn't meet the standards of what people were hoping to get for their kids and for the community. And so it's sort of balancing out this whole kind of competing interests of certainly from a public health point of view, there are more risks with kids going to school. It's not exactly clear. The data still is kind of ambiguous as to whether kids get infected as much as adults or if they spread it as much as adults. But schools, some of the schools have been really interested in taking and really putting a lot of effort into making things as safe as possible and putting in some protective measures, putting in plexiglass, trying to really get the social distancing to happen and all that. And so I think it's, we're not exactly sure how this is going to go. I think parents have the option to not send their kids, and I think some parents are going to choose that. And and how much it does raise the risk in the community is still a little bit of a subject of debate. If you look at other countries around the world, some countries were able to open, especially with the younger kids, without seeing an increase in cases in the community. Other countries did seem to correlate. So I don't think we're really sure yet. And I think, we're really trying to figure out how to move forward in a way that keeps people as safe as possible and still provides some development for the kids. A lot of it, again, comes down to money. If we, some places don't have good internet access, don't have good ways to do this. So, there's a lot behind this decisions. They weren't made impulsively, and a lot of work went into trying to keep the kids safe in that environment. And then we may go on the watch list, and we may not be able to move forward. So.
Thank you. Supervisor Brown?
Yeah, just real quick. I mean, whatever Upper Lake does or Kelsey or whoever, that's their business. I appreciate what, they're not, just like Dr. Pace said, they're not acting impulsively. They're putting everything they've got into this. And planning to open school is far more different than opening school. So it's hard to plan for it at the last minute. So I think it's a good idea for them, if they think there's any possibility at all that they'll be able to open, to plan on opening. They can always pull back at any time. So I appreciate the thought that's gone into it. And it's real easy to armchair quarterback, the decisions that are being made at that level, or any level for that matter. But the reality is, life still has to go on, and we still have to plan ahead, regardless of whether those plans get changed or not eventually.
Thank you, Supervisor Brown. Supervisor Sabatier?
Yes, I'm glad that topic was brought up, because I did have one confusing question, and this is from having conversations. The Lake County Office of Education put out the 4-phase plan. Is public health telling schools what phase we are in, or are they just randomly choosing which phase they feel that they're in? It's ultimately up to them to make the decision on what to do with their schools, because that's why they have individual boards and school districts. But it is our public health giving them the weather conditions for COVID-19 to let them know what phase we're matching in the county, because it's weird for one school to choose phase 3 and one school to choose phase 1. It just means that it's kind of it's subjective rather than based on any specific thing. And so I was curious about how that was working from your perspective.
Well, the phases aren't so much temperature gauge of where the county's at. That's part of it that influences it. And I've had I meet regularly with the Office of Education, and I've met with the superintendents and the boards to talk about this. I'm not telling them what to do, but I'm telling them what I think we can expect moving forward, and ways to keep things safe, and to talk about what the state public health experts are saying and things like that. But what I understand those phases are is sort of how the school wants to move forward with educating their students, how they feel, what they feel they're prepared to do to offer the students, keeping them as safe as possible while also providing the most robust educational opportunities. And so it's factoring in the status of the county, the number of cases, et cetera, but also it factors in, how the teachers are prepared, what the age of the teachers are, what the age of the kids are, what the Wi-Fi connectivity is in that district. So there's a lot of things that factor into this. Some of the schools that we're talking about moving forward and trying to open have been able to put, there's some of the smaller districts, and so they've been able to put a lot more effort into, protective plexiglass kind of apparatus to protect the kids and stuff. So, I think it's just, it's a very complex decision-making process without historical precedent. We can't look back and, and say, oh, well, that's what we did then and it didn't work. It's really trying to move forward here and engaging the kids and keeping them engaged as much as possible with the kind of the landscape that's with us. So yeah, I'm involved with those discussions, and ultimately it's a school district decision, but there's a lot of input from the state level of the California Department of Education, the California Department of Public Health, and me and other folks. So.
Thank you, Dr. Pace. Supervisor Scott?
I know with the Lakeport Unified School District, part of their discussion, they were looking to try to open up in stage 2 because the state of California was giving them the ability to do so. But then they came to realize that they did not have the filters or the supplies that they needed to go into phase 2. So really the question of what phase they were going to be opening up was really off the table for them because they did not have the proper supplies to open up into stage 2. And that's why they're opening up in stage 1. I know they're continuing trying to find those supplies to be able to open in stage 2. But a lot of school districts, they don't have that choice because they don't have the proper equipment in place to make that happen.
Thank you, Supervisor Scott. Jake, let's go to the next hand up here.
All right, it looks like the last hand we have up here is from Johnny. Johnny, I've sent you an unmute.
Yeah, can you hear me?
Yes, we can hear you. Will you please confirm your first and last name?
Johnny Garcia. Just a quick question. I noticed that Mendocino County just got put on the watch list. Can you clarify what puts a county on the watch list, and how likely are we to get put on the watch list the way our numbers are going right now? That's it.
Dr. Pace, I don't know if you want to go ahead and answer that, or if you have an idea.
Sure. I mean, yeah, that's part of what we've been talking about all along here is that, we are below the threshold to go on the watch list. What they're watching for is number of cases, number of deaths, hospital capacity mainly. Those are the main things they're watching for. Once you start seeing the number of cases rising and the hospitals are having trouble keeping up, that's really what they're looking for. There's some other secondary things like contact tracing and testing, but for the most part, what they're really looking for is what they're wanting to do is to pick up early when the number of cases is rising and the hospitals can't really keep up, so that we don't end up like New York, because when you really start clamping down, it takes 3 or 4 weeks before the results show. So that's what they're looking for. What I think it's very likely in the next 2 to 4 weeks that we could end up on the watch list, mainly because of what we're seeing around us. We're pretty much surrounded by counties that are on it. And what kind of my message today is, in the last few weeks, has really been, if folks can take measures to try to slow the transmission of the virus, we may be able to avoid that. I don't know. There's no guarantee for sure, but what we do now is going to affect things 3 to 4 weeks from now. If we're wearing masks now pretty meticulously, we have a lot less chance of having widespread transmission and then the cases and the hospitalizations weeks down the road. If we avoid social parties with people from outside of our families, outside of our household, we're much more likely to see the lower number of cases and avoid that. So, I think there's I think there's a pretty good chance. The momentum is that we're headed that direction. We may be remote enough and people have been careful enough and that we will be able to avoid it. But I think the more actions we take now, the much more likely we are to be able to avoid getting on the watch list and to avoid getting the state coming in and telling us what we have to do. And we have a lot less wiggle room when we get on the watch list.
Thank you, Dr. Pace. Okay, seeing no more hands up, Jake, can you open the room up and then
Yeah, I will open up the room here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
It's for COVID-19 agenda only.
For you? Yeah.
This is public comment on COVID.
Okay.
They haven't said the next agenda item yet.
Okay, Jake, go ahead and close the room up. Not hearing any public comment anymore in the room, so go ahead and close it up, please.
All right, will do.
Mr. Chair, there was one other comment that came in through e-comment, and if you're able to look at your agenda software online, you can see it, and if you cannot, I'll read it if you'd like me to.
Yeah, go ahead and do that, Carol. And it looks like we have someone in the boardroom that wants to make comment also, so we'll go to that right after.
Okay, so this comment comes from Kim Sainsbury, and it's mostly about testing, the things that that I've heard asked and answered today, but there is a last question that I don't believe has been addressed. So here it is. What is being done to get test results quicker from the Verily sites? Currently, we're looking at 2-week waiting times, et cetera. But then she says, what is Dr. Pace's understanding on the false negative rate for the PCR tests? I don't believe I've heard that asked today.
Go ahead, Dr. Pace.
Okay, so the false negative rate for the PCR tests from like Verily, which goes through the high throughput commercial labs, is low. That's actually a pretty darn good test, and I think the results you get are reliable. The ones that are not as reliable are the rapid turnaround tests, the Abbott machines, where you can get the results in 45 minutes. They're still pretty good, but they're much better if somebody's symptomatic. So we really are, if somebody's asymptomatic, so if, say somebody had contact with a case, but they don't have any symptoms, the false negative rate goes quite a bit higher. So it's sort of so I guess the quick answer is if you're using the Quest or the Verily site or one of the places that are doing the high throughput labs, I think you can relax and assume that test is most likely correct. If you're using some of the other options, which are quicker, more convenient in a lot of ways and more useful in terms of the turnaround time, you have to select who to test a little more carefully, or if you get a negative, but there's still some concern, you probably need to go get tested with a high throughput lab.
Okay, thank you very much, Dr. Pace. Supervisor Sabatier, is there anyone who'd like to make public comment in the boardroom?
Yes, we have an individual who would like to make a public comment.
Okay. Could you please state your first and last name? Go ahead.
Hello, good afternoon. My name is Christopher Harris. I just walked into the meeting just a couple minutes ago, so I'm not fully informed, but I was just wondering if Executive Order 92520 or Executive Order 92920 were in effect.
Okay. Do anyone can answer that question? I don't know if that's a question for Dr. Pace or for Anita.
I was just wondering, it's because it states, waives the mandate of public in-person accessibility to council meetings provided there are other means for the public to participate. It was signed by Governor Newsom on March 17th, 2020. I'm just wondering, because some documents within the county say that this meeting and further meetings will not This meeting and any further meetings while under a declared emergency will not be viewable in person. And I'm wondering if that's still in effect or what the guidelines is to that. And I was also wondering about maybe harboring hazardous environments that might be deteriorating and causing effect towards the COVID, like defecation on the ground in areas and things that are known that need to be addressed. I was just wondering if you had any idea about those, about that executive order and about, areas in Bruno's district. I think it's District 2. Looking at his card, yeah, District 2, County Supervisor, his area that he knows about this. And maybe he's just knows and contributing to the material deterioration of the area. I bought some parcels in the county and I put a porta potty there to clean them up. And within days, I received a notice from it's addressed to Jerry Campo of Action Sanitary, and it says that in accordance with CMC 193, a responsible person is a person who causes or materially contributes to the causation of a violation is declared a responsible person. They took my toilet. I was trying to clean the area. It was filthy. Now there's people there defecating on the grounds. I just wanted to make that a public comment about, the filth of the environment around us. And I'm a part of it.
Greatly appreciate it. I think, obviously you have some concerns. Right now, what we're in on the agenda item is our COVID-19 response and communication out to the public.
Well, that's
Mr. Chair?
That was just my one question.
Yes, Anita.
Yes, if the speaker was referring to the Brown Act flexibility in terms of meetings of legislative bodies, that still is in effect. And I can refer you to Executive Order N as in Nancy 71-20, wherein the executive order goes through in large measure and indicates any prior executive orders that have been changed and how.
Okay, I will look into that. That's cool. Anything else? No other answers? Thank you.
And
Thank you very much.
We do have another public comment in the room.
Okay, go ahead.
No, thank you, Sam.
Thank you. Joan Moss. I would like Dr. Pace to review what it means to a layperson to be on the watch list. I hear this a lot. What does that entail, getting on the watch list? Thank you.
Go ahead, Dr. Pace. We could quickly just kind of update it.
Again, this will be the second time after this presentation, and we've been at this for over an hour.
Oh.
Go ahead.
I know someone asked public comment. Obviously, if you could just quickly update it, and then we can move on.
Okay. So the watch list is the state's strategy to add restrictions to counties that are having trouble with the elevated number of cases, et cetera. And so it's a way to try to slow transmission of the virus. There are now something like 35 counties in the state that are on the watch list, and they have more restrictions on the businesses and on social movement around the county. And at this point, we are not on the list, but if we get on the list, then there will be more restrictions on basically many of the businesses is for the most part, and the schools.
Thank you, Dr. Pace. Okay, we're going to go ahead and close up public comment at this point, bring it back to the board. Are there any more questions or comments from the board at this time on this item? Okay. Seeing none, Dr. Page, thank you again for our update this week. And we will move on to our next item at this point. Thank you.
Thank you very much.
Okay, we have, I will ask the board at this time, any need for a comfort break or anything at this point before we start our next item?
Good to go.
Okay, we'll go ahead and move on with item 6.3, our 10 a.m. item, consideration of a complaint of Mrs. Bridget McQueen, owner of Lakeshore Estates Mobile Home Park. This was put on by Supervisor Scott.
Good morning, Chair and board members. Thank you for giving us this time this morning to discuss this issue with Lakeshore Estates Mobile Home Park. For a little background, for the past 2+ years, special districts and staff and myself has been unsuccessfully attempted to assist Ms. McQueen in resolving an issue with the sewer lateral impacting the mobile home park. We believe such matters fall under the purview of the state. We have agreed to allow Ms. McQueen an opportunity to present to the board with a summary of the issues along with the request for resolution during this board meeting. I'd like to give Ms. McQueen the floor to explain the situation she would like resolved, and then after that have Jan from Special Districts follow up with background and information and answer any questions that you might have. Thank you.
Okay, do we have Ms. McQueen here in Zoom? There we go.
Hi, can you guys hear me?
Welcome, Bridget. Yes, we can.
Okay. Thank you. Yeah, I know dealing with the sewer is probably not as important as coronavirus and everything else going on. So I really do appreciate everybody taking the time to hear us out and consider this. It's actually not, it's a very small issue in some ways, but sometimes small things can fester and become a big issue, which I think is happening here. So we bought our park at Lakeshore Estates in 2015. And, we had maps showing that, we're connected to the public sewer line, no big deal. It was, a manhole right on our property, 2 feet. You may have seen the image of the connecting sewer. I can share my screen, but I'll just kind of keep going because there's a lot of images I can share here. So anyway, everything was fine. And then about 2018, we started to get some backups. And, when this started, we called every plumber. Well, first, actually, we called Special Districts and said, hey, your manhole here that is our connecting, our clean out, the public clean out. That's what we thought. It's backed up and we need you to come out here. So when they did, they said, oh, no, we can't. It's on your property. And there's no easement. So that's how this whole thing started. And so we ended up calling every plumber in the county, and Roto-Rooter is the only one that has the equipment because it's a manhole and a 6-inch line. And when they came out here, they said, well, this doesn't seem private because you're connected. This is a lateral that's connected to another mobile home park that's got, 28 homes and it goes. I don't know how far it goes. So we thought, well, again, all this the proof was, well, this doesn't look like this is private. So, and again, we have no documentation showing that anything is private. So we talked again to Special Districts, and that's kind of where this whole thing went. And we found, originally we thought, okay, well, the Roto-Rooter reports were showing that some sewer, the grease was coming from our neighbor's park that was backing up our line. So it was in our interest to try to resolve this, and especially since there's nothing we can do. Roto-Rooter, we just said, okay, well, let's just route around here. Let's, somehow reconnect the line away from where our neighbors are connected. We asked Roto-Rooter, could you, help us do that? Sure, we can do that. He went to Special Districts. He went to the county, the city, and the state to try to get permits, and nobody would issue a permit to do the work. And that's really when we started to get involved in HCD, which is the state that manages mobile home parks. And they said, this is a public line. We would never approve your permit to operate as a park without local approval first, and everything that they see. This is definitely a public lateral that we're connected to. And they said, we would never give you a permit to shut down, your neighbor's line, because they also manage our neighbor who's a mobile home park. So we thought, wow, okay. And then that's what started the negotiations. So basically I was stuck in the middle. No one knows who's responsible of this manhole. The state who really manages us is telling us, no, that's the special districts, that's their manhole, do not touch it. If you touch it, they could pull our permit to operate. And it also could violate, it's tampering with the public line, which violates the Penal Code section 498. So, we were like, okay, but how do we manage if the local government doesn't want to take care of this problem, how are we supposed to manage something we're not really allowed to touch? And how do I have no control over my neighbors who are dumping sewer, not managing it. So when we went into special districts in the meetings, one person said, well, yeah, they don't have control over this. It's the state. And we don't feel that we have responsibility. So just call, public health. And when next time it backs up, and they have more power than we do. So I thought, really? Okay. And that's basically what happened in April when we had the hazardous spill. And I contacted special districts, talked to Scott that morning. I said, okay, we have another backup. What do you want me to do? He said, again, call public health. I said, all right, I did. And I have a whole report of that whole entire day. So now we have a hazardous spill report where we have, sewage dumping into the lake. And to this date, nobody knows who's responsible. This is just crazy. I can't be in the middle of this, and I have tried everything I can to try to fix this. The interesting thing about all of this is that being in the middle has caused us to really dig. And I went back to City of Lakeport and special districts, and I looked up every single report, how this park was built, what's going on. And actually, I can say from what we have found so far, the state is right. This is a public lateral. It was always a public lateral. And I just think what happened is that when they developed it, they just developed the line a little too far into our property. So what I'm going to do is I want to start going into some of these maps, and I'm going to share my screen, and so we can all see what we're talking about here. So this is, let's see. I don't know if you guys, I'm going to try this again. Sorry about that. Okay. All right, so I have, can you guys see the manhole?
Yes.
Yeah. Okay, it's somehow not showing up, so I'm just assuming that it's sharing. Anyway, this is the manhole in question. It's a couple feet from the property line. And really, if I'm thinking that I understand why there's no easement, and special districts is saying, hey, we can't come on and clean this because there's no easement to come on your property. We're talking about this manhole's just a few feet in our property, and I think it would be so easy to just create an easement, and they could come out, they could clean it, they could deal with our neighbors and whatever they're doing or not doing, not put me responsible for another mobile home park of 28 lots and a church. So that's just an idea here of what we're dealing with. So the biggest thing is this one map I want to show. Okay. me get to, I'm going to have to go this way. Okay, so you'll probably see the folder. Let me bring this one up. So this is just our own drawing, and you guys have already seen this. Special Districts has a map that's from 1965, and I will show you that map. We have it here too. But really, where the red line is where the manhole and the main sewer and the lateral should exist if everything was built according to the maps. It wasn't built according to the maps. In fact, it was built, as you can see in the blue line. And I think because the roadway and that main sewer line and lateral got pushed over about 7-9 feet, it's now going into our property. But this is why there's no easement, because the way it was built from the very beginning, it was built so that the sewer line should be in the roadway. Any public utilities that's in the roadway is considered public. So this is how we're looking at it, saying this is really what happened. I have to keep going into sharing. Okay, share again. Let's see. Okay, so let's go into the engineering plans. Okay, it's not opening. All right, so this is the biggest map that that really kind of made us stop and go, okay. So these are our signed, sealed maps. And the way I understand engineering plans is that these are legal binding maps. These, it's like a contract. And an engineering plan is also, it's there to show the relationship between, what's mine and what's yours. That what I understand of construction law and planning. Again, I'm not an attorney, but this is just, looking into this. And if you look at this closely, let's see if I can scroll in. This is what this lateral, so everybody understands, was existing before our park was ever built. So when you scroll in here, you could see it says existing manhole number 20, and you can see the lateral. So now what I think is interesting is when you look at that, you see two lines right there. This lateral that's only 3 feet away, it goes past Colonial Village and past the church and then dead ends. So tell me how a private line would actually, if, because Colonial Village was built first, and you can see on the 1965 maps that their property is indicated as existing.
Where is
there's nothing.
Bridget, I don't know if it's the same for everyone else, but the picture we have on our screen is quite a bit smaller. It's up in the right-hand corner. Is there any way to make that bigger? I don't know what you're seeing on your screen. And any other board members can speak up.
Yeah, I was going to ask, because she's referencing, she said, as you can see the 1965 map. I don't see a 1965 map anywhere. I see a picture.
Oh, okay. Well, this right here, this map is the.
We're not seeing the same thing you're seeing. We see your scroll moving around, but there's a small map over here in the right-hand corner. But it's just small. So I don't know.
How do I get this to?
It's not on our. It's not in our backup information either, so I can reference it. It's not.
I think you
It actually should be this map.
I think you need to share the screen with the program that opened up the picture, because all we see is your desktop files with a bit of a thumbnail.
Oh, it's
of the
not
picture.
okay. You know what? I'm going to do this. I'm going to try something else. Share screen. I'm going to try.
I have. There's a thing called sewer map planning. Okay, and that's the 1981 map, though. You have, okay.
This is when our park was built.
Okay.
And okay, so you guys can see this now. And I'm going to scroll out because I scrolled in.
Okay.
There you go.
These are engineering plans, okay? And you can see the date, 1981, January 15th. This is signed, 81, sealed, everything. So these are these are the legal maps, the legally binding maps, okay? And this is literally our contract with the county. Well, at the time, it was the city of Lakeport. And the thing is that when the special districts took over, they don't have any maps. They don't. So this is why we had to go to the city of Lakeport a lot of times to find all this. We asked why did special districts not have all of these maps that show, and we don't know. We never got an answer. So there is there's a mess in how this happened. But what I want to show you is, can you guys see when I scroll in?
Yeah.
Okay. Now, do you see these two laterals right here? And you see this is the existing manhole that was there. And also you can see this is the property line. And you can see
Okay, you're not, do you have a pointer on it anywhere, Bridget? Do you have a pointer going to it? Because
Yeah, she does.
where is it?
I have just a little, it's a plus sign.
like a
That's
big
what,
I'm not seeing it. Move it
can you
around a
guys-
little bit. Let me see.
the plus sign.
Can you move it around a little? I'm looking through 17, there, I see it, okay. I'm looking through 17 sheets of glass here for riot control, so I can't really, there's a little glare.
I know, and this is why I went on Zoom, because I thought it would be easier to show you guys these maps,
Yeah.
because
Okay.
and I'm sorry I have to get so technical here, but this is, these maps are really, they describe what happened and why we have such a mess right now. So they're really, really important. But hopefully you can see this. In this, you can see, this map is not the one that shows how far the lateral goes. But we have other maps from 1965 that show, the sewer. We have video from Roto-Rooter that shows our lateral goes past Colonial Village. It goes past the church. And I'll show you kind of a layout that we drew. But before I do that, we actually tied into this lateral. And when we tied in, you can see the main line is only 2 feet away, 2 to 3 feet away. So what's interesting about this, when you look at that, you can see, first of all, this lateral existed before us. So we did not create some, hack, what was the bootleg system. Like, this is something we legally tied into. We have the letter, it's part of the attachment I sent to you guys, asking for approval to connect to the main sewer system when it was built in 1981. We got approval. That letter is also CC'd to special districts. They said they didn't have that letter, but okay, again, missing documents. But we show that our park, when it was built in 1981, was connected legally to the main sewer line. And you can see they did it through this public lateral. Now, I just don't understand how a park in development, major park with 28 spaces, would connect to a private line that's just 2 feet away from the main. But why would they do that? It had to be connected to that lateral because, we have, how many feet of sewer do we have in our park?
1,800.
We have 1,800 feet of sewer. What does that save a park by just going 2 extra feet? It doesn't make any sense. When you look at construction, when you look at how things were done, no, we connected to that main lateral because that is the main, that was a public lateral. That was the best way. That's the way the system was designed publicly for all connections. So, and again, when you look at how close that main line is and the lateral, they're only a few feet away. That also says that they were built at the same time, because why somebody would have a private line, that's only 3 feet away. Again, I'm not a specialist. My husband, he can talk more to this of how sewer lines are developed because he's a structural engineer and he had several years and masters in building sewer and water lines. So that's been very helpful to understand these maps and what the intent was. But anyway, all I'm showing you on this map, it's our legal document. It's legally binding, and it is showing we are connecting to a main public sewer line. So I'm going to stop the share on that. Is there any questions on this before we move on?
I do have a couple. If I could.
Go ahead, Supervisor Brown.
So I'm familiar with this project. I actually remember putting the initial meeting together with Supervisor Scott and special districts and all that. We met with staff, and it's been a while, and I was out of the loop on that afterwards. But I had some questions at that time, and I wasn't sure if they were ever followed up on. Maybe you can fill me in if they have. I had asked that we find out the survey, the exact survey of where the points were in relationship. And I see on the map, I see that, but I want to know on the ground, are there pins that are placed there that show where those survey markers are?
Sure. So we did look into that, and there are no pins. When we talked to special districts about it, they said it really doesn't matter anyway. So we did talk to a surveyor, and basically because there are no pins, they would have to start from scratch. But he could tell. Well, first of all, two things why we didn't go with the full, recreating this whole thing, because we basically found out it didn't matter. And the reason it didn't matter is because if the line is on our property, okay, we're in the same situation, then what? Special district says it doesn't matter. There was no easement, so we all already agree, like everybody agrees it's on our property line. So, but the fact is there's no easement. So getting a surveyor, they said it wouldn't matter. Okay. Let's say it's not on our property line, and it's outside the property line. Okay, then what? Well,
then it's in the county easement, then it's in the county right of way, and then it may not make a difference to some.
It still won't go on our property. They're saying no, it's.
Because I know there was a block wall that was placed out there, but the block wall, just because there's a fence there or a block wall there doesn't mean it's on the property line. So I know it's referenced in the picture that the block wall is the property line, but if it has.
Yeah, because that's what they're saying.
It's going to be really difficult on Zoom. It's really difficult live when several people are talking at the same time, but we need to probably just one at a time to be able to get this through. So it'd be interesting to find out if the block wall is actually on the line or in the county easement. That would make a difference. I don't know who told you that it wouldn't make any difference. If it's in the county right-of-way, that makes a difference. If that process has been eliminated, then we move on to, okay, it's on your property, now what? So we look at this, and then you suggested that, or you used the term, we hooked into it, but did you and your husband actually hook into it, or was that hooked
our park? So the developers of our park in 1981. We've only owned the park for five since.
Right. Okay. So it was hooked into in 1981.
Yes.
Okay. So on the 1965 map that you talk about, what's the relevance of that?
Okay. So, and this does go back into the survey report because when I
Excuse me, Bridget and Supervisor Brown. I do know that Jan Coppinger, Special Districts, put her hand up. I'm just wondering at this point if it would help at all, maybe Supervisor Brown or Bridget, that Jan can answer, or she obviously has something she'd like to say. So go ahead, Jan.
Yeah, thank you. I never said, or none of us at Special District said a survey wouldn't matter. We did have a meeting, and I believe Anita was in attendance with that meeting, and it was determined a survey would clarify, because if it is not on private property, if it is in public property, we would honor that. We would take care of it. But we have to make our decisions based on what is, not what was intended in 1980s, but what is today. And if that manhole is not on their private property, we would take it on. So the survey was really the critical factor to help get here. So I'm not sure why Bridget's saying that we said it didn't matter, because it definitely does matter.
I know that was the point that I was trying to get. Yeah.
I'd like to explain that because, I mean, look, if you guys want to go get a survey and pay for that, because the survey right now will cost thousands of dollars. I'm already paid thousands of dollars to clean the sewer. And by the way, what do we do about the storm drain? So, you know, there's a storm drain that's sitting here too, that there's no easement for. And nobody, you know, oh, well, you know, it's just there. And I'm at a point now where when I look at the intent of the maps, I don't even care what the survey report says. That is not supposed to be on our property. So if it is, or if it is not, doesn't matter. The maps show it was supposed to be designed outside of our property line. So then let's just honor that. Why can't we look at the way it was supposed to be developed? These maps, what's existing, if we're going by what's existing, that's like saying that if your main line happens to go through our property, not just the lateral, that, you know, oh, okay, then it's our, you know, responsibility. So why is a survey going to change anything? That's what I don't understand. Because if we say this is on our property and that's what the survey report says, then what? We have to take responsibility? And for a storm drain and for anything that just happens to go through our property. This is why you have maps. This is why maps that were developed back then are important, so that we understand how it was supposed to develop. And if it wasn't developed according to engineering plans, we can go back to the maps and say this was the intent. And that's why I didn't want to spend thousands of dollars. And besides, you know what the surveyor told me when I looked into this, he said, all we're going to do is look at the distance of the entire roadway. We're going to look at your neighbor's property line, and we're going to measure based on all of that to recreate it. Well, guess what? That property line follows right along all the other neighbors. We can see that the roadway is 60 feet, and it follows that, and we can go into the 1965 maps. So, you know, we have all the maps to show the engineering design and the intent. And I really don't understand. I think that this is just a delay tactic because it doesn't really solve anything.
Well, okay, so with all due respect, Bridget, it's not a delay tactic. This was something that I asked for 2.5 years ago. So it's not something I'm trying to ask for a delay. And I don't know what surveyor you talked to, but I don't know any surveyor that would say all we're going to do is go along the existing fence lines and assume that they're where they need to be and just go from point A to point B. That's not how surveys work. And it shows on the map that you're showing us right now that the property line is to the left on the map. It shows it's to the left, which would be kind of to the east of where the manhole is. That would be, if the main line, the line was put in like it shows on the map, which I don't know why they would have diverted from that. I don't understand that. But what I think may have happened, and I thought 2.5 years ago, whenever it was, that somebody put that wall up in a convenient location for them and thought that they were going to gain a little extra land or whatever. That happens all the time. And it wasn't you, it was whoever put the wall up. But they did, and to your detriment, it looks like to me. I don't know. I mean, if a survey would resolve that, and they're not just going to come in and measure your neighbor's corner marker and your other neighbor's corner marker and then run a snap line across it. That's not how surveys work. So that would resolve that. Now, again, if it came up that it is on your land, and that's a separate issue, but it could have been resolved, I think, easily with a proper survey. And I'm still not clear on this 1960. The problem, for the purpose of all the board members, and I remember telling Tina this, I'm not sure if she remembers it or not, but in 1965, that was not Lakeshore Boulevard, that was State Highway 29. And so the city of Lakeport had put that in, sometime after that, but that was state highway. So I don't know if the alignment of the road has changed any as it became county road in early 70s or late 60s, somewhere around 1970 is when it changed. And So I'm not sure if they changed the roadway and, they actually put it where it says on the map, but the roadway's been changed since then. I know Director Shaw, when he was doing public works, he got a lot of money for bike lanes, and they did a lot of changing of alignments and widening and changing a little bit of the roads, and I don't remember if anything happened out there. But a lot of things could have happened since 1965 and even 1981, but a survey would definitely resolve a lot of that. I don't think that putting that wall in did you any favors. They could have just as easily put the wall on the other side of the manhole cover, and no one would have ever asked a question. I think special districts probably would have taken care of it, assuming that it's in the county right away. So I think a survey would resolve that, but it may require that the wall needs to be moved too. So I don't know.
Yeah, well, all I can say is that I think it is in our property based on how it was designed, and again, it's not going to be. It is like the surveyor that we talked to was one right here in Lakeport, so it was local, and they know the area really, really well. And they didn't say that they just look at that, but they don't have like GPS. I guess it wasn't done back then, so they would have to actually go in and look at many, many factors in order to create that.
Right.
So we can just tell by the roadway and how this was done that, and the way the ladder is built, it was built to be a public lateral. And if it's on our property, I just don't see why we can't just get an easement and it would solve all of this.
Well, okay, so that was the other thing I was going to say. You talked about, if a main line went through your property, nothing gets happened. No, that's why we do easement agreements and things like that. One apparently wasn't done here. I'm going to get to this in a second, and maybe now is a good time to ask, and if she can either answer now or come up with the answer as we're through this. But ultimately, I want to know from Anita, what are our options here? Because this is, if it's on your land, it's on private property, so it's not something, I'd be surprised if the board, as we sit here today, just says, yeah, we'll take it from now on. There's a lot more that goes into it than that, but I want to know from Anita just exactly what our options are. What can we do?
Mr. Chair, may I?
Go ahead, Anita.
Thank
Yes.
you. The process here raises a number of questions. There's not a mechanism in this agenda item today for your board to make a decision. I do recall, and perhaps Jan or Supervisor Scott may recall as well, that at the last meeting it was suggested that the McQueen's file a complaint for damages with the county. What that does is it accesses the alleged problem, and the independent third-party administrator who sends out an investigator and investigates and reviews the claim and can recommend settlement or resolution or denial depending upon the outcome of that. But the property owners would have a complete opportunity to present all of their evidence, and all of it would be considered. And in order to avoid gift of public funds issues, that claims process is in existence. Now, the resolution could take many forms depending upon if it turns out that this is an obligation of the county, then the resolution would have to be negotiated between the county and the property owner. But all of that's very doable, but I'd strongly recommend that an actual damages claim be filed in order to activate that process immediately.
Okay, yeah, I didn't do.
Thank you, Anita.
Yeah,
Go
thank
ahead,
you.
Bridget.
I didn't file the claim just because I really didn't want to have to go into damages. I was hoping, that we could avoid, not asking for damages, and I didn't want to go into lawsuits. And I was trying to think that if we could just look at these maps and honor the maps instead of looking what is existing now, it really is irrelevant to what is existing now. It's what was supposed to be the planning and how it was designed. And I mean, I could sit here and show you all the other maps that we have and then the analysis that we have of how everything got scooted over 9 feet, and that is why we don't have an easement. I don't know how much you guys want to dig into this. I've spent quite a bit of time, and we have letters asking to be connected to the main sewer line. And what happened when we built the park too is that you have to understand. When the park was built, the engineers at the time, they don't go and look at what's existing on the ground. They are actually just going to go by previous maps. So everything started from the 1965 map. And that the way that our road and main sewer line was built is still today different than what the 1965 map even shows. So everything that went prior to that sort of built on this mistake. It happens. I mean, you want to build a line on somebody's property, but it ends up being, closer in. So anyway, that's why I just think that why are we spending so much time looking at what is existing when we can look at what the way it was engineered and the way it was planned and the way that our agreement says and go from there. Because I don't know about you guys, but we're a mobile home park, we're on limited budget, and I've already had to spend thousands of dollars cleaning this, and you're asking me to go and spend thousands of dollars more to get another, to basically prove that it's on our property or not, and it still doesn't even really matter because the maps show it's designed not to be. So I don't know. I just feel like it's a lot of money that we don't have. Maybe the county has. And then, if I go into damages, if you guys want to pay for all of this, I guess that's to my benefit. I would get all that money back and the headache. But I was kind of hoping to do this where we didn't have to, I'm actually trying to be nice. I'm trying to figure out a way to do this where it's not causing the county any more money. It's not causing me any more money. And how can we do this in the easiest way? And I just thought this was the easiest way, the nicest way.
Mr. Chair?
Yeah, go ahead, Anita.
Damages doesn't necessarily have to be monetary. If the county is responsible, the county can take remedial action. There's a number of ways to resolve it. But just hearing a presentation and making a decision today is not one of them, given the fact that you do have to worry, no matter how justifiable this claim might be, this is not the county's process. A damages claim just simply has to be completed. It costs nothing. And it's filed, it goes to our third-party administrator, and they do the investigation. A lot of this, hopefully, could have been resolved well before now. We can certainly ask them to take this up immediately if that's your board's wish. But that process will be able to come to some kind of a determination or recommendation for everyone to consider. So again, filing a damages claim will attaching the documentation and 3 sentences explaining the problem will actually put this into a good process to move it forward toward resolution.
Thank you, Anita. Supervisor Brown?
Yeah, thank you. So that makes a lot more sense, Anita. I appreciate it. There was some confusion because Bridget called me last night. We spoke for a little bit, and she had gone through trying to get me caught up on what I'd missed for the last couple of years. And one of the things that she said was that she was told by staff that she should go ahead and file a lawsuit. That doesn't appear to be what she was told. Filing a claim is not the same as filing a lawsuit. We all know that, or those of us that deal with it.
No, I rarely suggest filing a lawsuit.
I get that. I get that, and I was confused by that, but this makes more sense. But I could see easily how she could confuse the two, or not be able to make the distinction between the two. No, hold on 1 second. Hold on 1 second.
Okay. Yeah.
So that's just like you said, it's what's done is done, that's done. So I don't think there needs any more explanation or anything. Anita's explained it really well, and I think we need to move past that. So So filing that claim. So here's where I am with the whole thing. It would make it easier if it was on county property. It would make it so much easier. But I guess to have the survey done is just a point of curiosity, and so there's no point in doing that. No one wants to do it, so the county would like to have it done, but that doesn't appear to be the case. And let's just assume that it is on her property. It's also a main line that services several other properties up and down the road that this property owner has no control over. We have a hard time taking care of the stuff that we have, and Special Districts does an excellent job of that. So, to take something in that is not something that we put in, not something that we installed, and it may or may not be inferior, I don't know, but it would be something that'd be a tough call to put that on Special Districts, but it may be something that we need to do, and here's the reason I'm concerned about it. We've been going back and forth over this thing for since the current owner has had this property with things that have plugged up the lines and all that, and trying to figure out who's to maintain it and all that. This is in a very sensitive area as far as elevation, as far as the proximity of the lake. We haven't had any flooding since it's been 3 or 4 years that we had flooding in there, but there have been times where there's flooding on a regular basis, and that could happen again. It'd be nice if we had some ability to maintain this, or it was maintained, and I think we can maintain it better than anyone can. It would be good to have that security or insurance that it is being maintained properly through the efforts that Special Districts can offer and a private property owner couldn't, or with Roto-Rooter or anything like that. And so that's one thing that I just want to consider, that and I said this early on, some will remember, we don't do these things because it sets a precedent. We don't like taking on roads that are on private property and water lines, sewer lines, and all this kind of stuff that are on private property. But each case stands on its own merits, and this may be one of those where we need to look at some kind of an easement agreement or some kind of a maintenance agreement, something that will guarantee that we don't have a spill there into the lake. And that's really the bottom line. I don't know where the state says, it's not yours, so you're not allowed to touch it. I'm not seeing any emails that reflect that. They do everything by email, so if there was some email, then maybe the state wants to come in and take care of it, because it's the state it's their responsibility to oversee trailer parks in the county. So maybe it's something they should do as well. But I don't think the property owner has the ability to guarantee the county that will be taken care of in a manner to protect the lake. And that's not a criticism of the landowner. That's a tough thing for any landowner to have to take care of a public sewer system that just happens to run inside their property. So as maybe we're going to have more presentation on this and more board input, but I wanted to throw that out there as to be thinking about that, because that's where I'm leaning to. And I hate to cause Special Districts that heartburn, and Anita as well, of one more thing, but the more I look at this, the more I'm like, well, we got to, something's got to be done, not just for convenience of the landowner, but for the protection of the lake that's right next door. So,
thank you, Supervisor Brown. Obviously, it's been going on for a while. I see Jan Coppinger. Jan, go ahead.
Yeah,
Jan?
Thank you. I agree. We need to come up with some kind of solution. It's not fair for Ms. McQueen to be financing this manhole when it is used by others. I will say we do have many mobile home parks that are customers of ours. Every one of them does have manholes, and they have one manhole right next to property lines. So there's nothing unusual about that in this situation, to see a manhole right at the edge of the mobile home park. That last manhole right at the property line is their last point of responsibility, and where we take over from there. What is unusual about this one is that 2 others are tied in and using the same manhole, and there doesn't seem to be a mechanism to get the others to assist this Ms. McQueen in handling backups and spills. And that's what I think is needed, is to get the others involved. We did go out and camera these lines. We cameraed all the manholes that, I think there's 5 of them in this park. And there was a significant amount of grease and debris in these manholes. We, special districts, don't have control over the people living in the mobile home parks. And that's why they have to manage it right up to the property line, and we take it from there. The people that live in these parks are customers of the park. They are not customers of ours. The park is our customer. Something we did go back, we pulled all the reports from environmental health, we looked all through our records. There was no reports of any backups or problems with this manhole until starting in 2016, and then they've just gotten worse and worse and worse. And looking at the amount of grease we did see on the videos, I think there's other ways to resolve this, but somehow if there's just a mechanism to help Miss McQueen get some teeth into these other 2 properties that are using the same manhole, so that she's not footing the bill, because it happens to be on her property, the last point there, and she's the one that keeps having this dropped in her lap, and that is not fair. And there is something, we need to do something to help with that. But I don't know what it is, because like I say, the mobile home park people are not our customers. We can't go in and tell them stop flushing grease and debris down your sewer lines. We don't have any control over them. So, but to see the map itself and to see a manhole right at the property line, very typical. We see it in all of our mobile home parks. And Scott Herder's been working on this all along. He's got the videos, he's got pictures, and I'll let him present if you want to hear it, or if you have decided that the best course of action is to get the third party in to investigate it. I'm comfortable with that too. So I'm going to leave it up to you guys to tell us what you would like.
Thank you, Jan. Supervisor Sabatier?
Yeah, I was going to ask if we can finish the presentations so that we don't get stuck on one thing when there might be some explanations, or there might, and then we can go ahead and elaborate a little further on our discussion, because I know that I don't believe that Ms. McQueen was completely done, and I know that and our special districts was also planning to show us some of their presentation as well, and I think it would be good for us to hear all sides and the whole story prior to really digging deep into the weeds.
Okay, Ms. McQueen, are you finished with your presentation, or do you have a little bit more, and then we'll move on to special districts?
I mean, there's a lot more, but I want to talk a little bit about the backups, and Jan's right in that I don't think there has been any problems with this manhole up until recently. And again, this gets a little bit controversial, but we did notice that 2 things, the floods and also that pump station that's on Park Avenue was having a lot of problems of going out. And I know they said that when it loses prime, it actually still is by a gravity system. But I mean, a gravity system can only work so much. And so what we found when we looked at our manholes, there wasn't grease on, all of them. It was just really the first 2. And we also found, and we have all the Roto-Rooter reports that I can show you, that when that spill happened, that was also another time where the pump station was not working. So Roto-Rooter came out here, they cleared our line, it didn't do anything. And they noticed when they came on, both of the public and the private sewer were backed up. So their point was, we know that, how can we say that this is something that's our fault? The other thing in our investigation with sewers is that when something backs up, we know that grease and, toiletries, whatever that nut is, it floats to the top and it carries, right? And it's going to just keep carrying. When the pump station starts working again, the water goes down, but then you have all this stuff stuck. So it may not plug right away. It could plug, a month later. So, and this is what makes it difficult of who's at fault. And we can go back and forth on the evidence here, but several things are a problem. We're having rolling blackouts. There's no generators that are on that pump station. I mean, I understand these are all, we just are in this, quagmire, a lot of problems at the same time. But, they have, special districts has the rotating generators, but that is going to hurt our system. And that is going to push a lot of that grease that's not just even from my park and the other park and neighbors. It's pushing it all up our line. And then when it starts working again, that's going to drain and we're going to have to deal with it. And so all I know is that the last time that we've had Roto-Rooter out here and the pump station was down, they had to come back. And this is an interesting point. So when they finally cleared it and the line was flowing and the pump station, it took them days to get that working. And the state was involved in the whole thing, so he watched the whole thing going on. And I want to say something about the state too, in that they would never, ever take over this line. And the reason being is they say, we do not give you a permit to operate, or any of our parks a permit to operate without local approval first. So this is 100% something that is a local issue. They will not get involved in a local municipal line. So, that's why I'm in the middle of this, is because they 100% believe that this is a local issue. And this came from not just the local HCD inspectors, but he went and took this to his managers as well. And they too have had issues where other counties have had something where they didn't want to take responsibility and they wanted to put it on the state, and they said no way, and they fought back. So this isn't like we can just put this on the state. It's not gonna, I'm just telling you from what I found, that's not gonna work. But anyway, figuring out who's at fault here, all I know is that special districts has the equipment. They could come out here and clear that line. And let's just say that my neighbor is having a lot of debris, which Roto-Rooter video reports are showing in several of the blockages it's coming through. Right now, they're telling me in the emails and communications that they would have to shut down all of our parks to stop, the grease from my neighbors. I've sent countless letters to them. I've tried to talk to them. I've talked to the state about my neighbors. And the problem for me is, even if I were to maintain that line, who gives me permission to go and turn off their water? When there's a spill, like when we had that spill, we turned off our water, but I can't go turn off my neighbor's water to stop the sewer from coming in. I can't turn off the church. So again, I mean, I cannot, no matter what kind of maintenance agreement we put together, you would have to give me legal right to go and turn the water and be able to go in and manage that line fully as like what a municipal sewer district does.
That's not what that's not what a maintenance agreement does. So we can do it without giving you the police powers.
And I would have to be able to have some funds to be able to pay for it. So I just
what is it that you're okay? So maybe you're misunderstanding what I'm saying. What funds would you need for us to maintain the line? For us to have a maintenance agreement to maintain a line on your property? I'm not clear. You can't have it both ways. Yeah, you can't have us take care of it and then pay you for us to take care of it.
So you would take care of it, but you would pay. I guess I didn't understand it.
That's what a maintenance agreement is. We have an agreement to maintain a line on your property.
Right?
I know you guys are talking over. I think, obviously, if we as the county decided that we were going to take care of it, there wouldn't be any extra income that would come to the property owner. But we haven't made that determination. I know those are ideas that have been thrown up by Supervisor Brown, and what we're trying to do is get through the presentation here. It looks like, obviously this is going to be ongoing. It has been ongoing. I think there has been one presentation from Anita that there is a damage for claims. I apologize, I got it backwards, that you can get done. And, that would, I think, helps move us in the right direction at least. It seems like it's been going on for a while. We've got to make some definitive action here to help try and move this thing to a resolution. Bridget, I know we can go all day. You said you have a lot of information. Is there anything else that you would like to present, on behalf of, your presentation today?
I can just show you a few more maps, that to me that shows that this is, I showed them that, let me just, and then I'm done. I mean, yeah, cause you're right. There's so much data here. Let me just see if I can find, I might have to do this twice. Okay, so that was, you guys saw the engineering. I just wanted to show you, did you guys all see that public storm drain image that I sent? This is just an example.
Yes.
Okay, so I'm not going to show that one again. Let's see. Chimek, was there was that one map that you wanted to look at? Well, and I guess it's just a matter of, do we want to go into the maps that were the 1965 maps? My husband's been really looking at this, and he can explain in an engineering perspective why he believes that the road and the roadway is a lot closer. I don't know if it's going to help or not, if you guys want to hear that part, but it has to do with the maps and let me see if I can find.
It's what you want to finish on your presentation here. Obviously what you think is the most pertinent to your presentation and your argument on where the resolution you're trying to get to. So it's really up to you at this point. I know we've been all over, but I'll put it back to you.
All right. Well, this is the 1965 map. And this one actually is to scale. So can you guys see this map?
Mm-hmm.
Yes.
Okay. So I have my husband here.
This is the top of the map is plan, is in the scale 1 to 50. And when we are looking at the manhole number 20, closer to the right.
Do you guys see this? This is the close-up. This is manhole 20.
Okay.
Yeah, I want just to explain this the difference right now what we have in reality, because the width of the road is exactly what we have right now, because we own property on the left, on the right side, just mean on the lake side and on the mobile home side park, and on both sides we have established the property lines that can be verified, but it's the over 60 feet, and this is how much the roadway is. And now on the maps. A manhole and main sewer line is away from our property 11 feet. But in reality, when you look at the pictures, it's just next to our wall. We are talking about 9 feet difference. That's why when the lateral was built from this manhole and will be based on this map, supposed to be on will fit perfectly in the roadway and still be the 6-7 feet away from our property. This is just when the main sewer line only in this place is too close to our property, and it's a king. We check the manholes the number 19, number 21, 22, and 23. They looks pretty the correct with the map, the map is showing. There's maybe difference 1-2 feet, but this can be even the because of the scale of the map. But when we are talking about the difference 9 feet, this is huge difference. Very difficult.
And this is where the problem we think started, is that somehow that whole road got shifted over to
the main sewer line.
The main sewer line got shifted over to what they were planning to do. And again, it's not that way anywhere else. It's just this particular one. So when they put in that lateral, again, it's only 3 feet away from the main. So that's why we do believe it was put in at the same time. And the fact that whole lateral goes to all the way to Colonial Village, all the way to the church, and then past it. and then dead ends. And why would a private bootleg system, pass somebody's property? That's the thing. So many of these, when you look at the maps, it really looks like they developed this to have a public lateral that could be accessible. And
it's built almost on the same under the ground level, around like the 6 feet. This means even when you're trenching and, for example, if the main line already will exist and you have to trench and build next line to this, actually you are very close to damage the main line. Most contractors most designers will not plan this kind of lines so close if they will intend to go on private, their property. That's why they were so close.
Hospital administration, this is Lacey. How can I help you?
Good afternoon.
Somebody else.
Put that on mute, Jake.
And that's why, in my opinion, an engineer, I can say, and contractor, I can say those two lines were built even in the same time because they're on the same deep and were installed in the same trench. When the difference, the space between those two pipes is only 3 feet. When you trench the trench for a 15-inch line, this trench needs to be pretty wide for installation. That's you cannot even, for example, if somebody will go and try to fix a main line, it's also very close to the lateral line. This is from the engineering standpoint, nobody will engineer this if they will not try to fit this in a roadway. They will just go straight on the private property.
Yeah, that's the other thing.
And this is 6 feet under the ground. It's and when you trench the 45 degrees even slope, you can see how wide slope, how wide this trench needs to be.
And the lateral goes several commercial properties right next to the main. So anyone that is to maintain that lateral, I don't even know if that violates OSHA requirements or how that would even work, but to trench that lateral and maintain it only a few feet away from the main, I just can't imagine that the city of Lakeport originally would approve a private lateral like that, or does even design it that way. It to us, from an engineering standpoint, none of this makes sense that this could ever been a private line. So, and then the other thing that's interesting is the church. And we have some, I don't know if this relates or not. I'm going to just bring up the church documents here that we try to figure out how our neighbors connected this line from the beginning. The church was built in 1995. And we were told when a church goes in and if it was to connect to a private line, they would need a section 402 or to satisfy section 402, which is, not the one that knows this, but it's the Lake County Sanitation District Sewer Use Ordinance. So we couldn't find any of that, but I just can't imagine that a church could actually be built in 1995 when both these parks were existing, and that we weren't notified that we somehow are having another public property tied into our private line. There's no documentation in anyone's file, city or county, about how this church got approved to be on that sewer line. But what we do see is that let me see if I can find this. When we looked at it, hold on. There's no, okay. Can you guys see this or do I have to come back? Is it small?
Come back.
Yeah, it's small.
Okay, I'm gonna share screen. So this is their approval for the church that we found, document. And it says in special districts, sorry you can't see it, but this was photocopied for us and that's the best, but it's existing connection and what they connected to. So we know that, and they did, this was public. It's not like, again, it wasn't bootlegged into the sewer line where they did it without approval or something. So the other thing that I wanted to show that is just, you know, it's a little odd, and maybe somebody else has a better explanation.
So, okay, so I'm gonna come back, try to circle this back around, because whether the church hooked up or not really doesn't have anything at all to do with what we need to do with your property. I think it's a given. The church is there, they have sewer, we know that.
Well, we're just trying to find history of what was done. I mean, here's again, the sewer is the only thing that's got the missing.
So the history is a perspective. You're offering a perspective that this line was running down the roadway like it's supposed to, and then all of a sudden on your property, it darts in and comes onto your property. And that's why the survey is so important. We need to know exactly what's going on, but I think we're a ways away from that. Even if we do need that, that's still a ways away. I think the easiest solution is to go back to what Anita's original suggestion was, and that is to file a claim so that we could have our third party investigate this and look at it, and then identify what the issue is, and then through that we'll identify what the solution is. I don't think anything can happen until that happens, and that costs you nothing. That's a claim that's just filed. We get claims all the time. People get flat tires from potholes. They file a claim. You know, we get claims all the time for a lot of different things. So this is not a big deal, and it costs you nothing. But I think in order to get the ball rolling as to identify the problem, identify the solution, that's where it's going to start. And Anita, maybe you can correct me if I'm wrong.
Go ahead, Anita.
No, sir, you're not wrong at all. This will give us an opportunity to see the third-party administrator in its investigation will make recommendations if the county needs more information. It will identify if there are larger issues beyond just the claim, but the claim is what activates the county's ability to look at something and take action. The Constitution prohibits the gift of public funds, so just coming outside that process and saying this is wrong, you should fix it, it is fraught with problems. And the claim process streamlines all of that, and you can get down to looking at, okay, what caused what and what is the best solution. And then your board will have information that you can rely on. And certainly if you want to participate in the solution process, you can always do so. So this can come back to you with a recommendation and a solution if you'd like. It's not that you're abdicating anything. The county has an agreement, a contract as part of its membership with the State Association of Counties Excess Insurance Authority. So this is what you agreed to years ago in terms of handling claims. And again, it doesn't have to be monetary damages, it can be remediation. But the property owners here can do this without it costing anything.
Okay. Yeah, and you know, now that I understand that better, I mean, I don't mind filing a claim, and I love everything that Rob said too. He's right on in our situation, and that it's very hard for us to manage that, and all we have is Roto-Rooter. They're the only ones that can do this, and it is ongoing, and it does hurt the lake, and it's a lot of responsibility for us, and I care about the lake, and I mean, it's just, you know, however we can fix this, and if this is what we can do now, yeah. I just wanted to, you know, wanted me to present everything, so I just thought I'd show you everything that we have so far. So I think that's pretty much, that's it.
Thank you, Bridget. Greatly appreciate it. It seems like we do have a path forward. Like you said, you know, the claims will allow us to, like you said, hopefully come to a path where we can resolve this issue. Well, it's been on for a while. So Supervisor Scott, I know you had your...
Just that I agree. That is the direction we've been asking to go, is to file a claim, get a third party in there. I mean, definitely looking at this, mistakes were made, and it's definitely not a proper way to put sewer systems in, having connect onto private property. So I definitely think filing a claim and seeing what a third party thinks and going from there.
All right, Jan? I don't see any hand up, but Bridget, hopefully this will be a step forward. That, you know, we appreciate all the information, everything has been presented. And, you know, hope that you understand, you know, the next step in the process here will allow us to get down the road so we can really come up with some resolution or more information as we can move this thing forward. I know it's been going on a while and it's frustrating, but it seems like we have a plan laid out to help us move forward now. We'll go ahead and ask at this point, are there any comments or questions from the board members? Supervisor Crandall?
Yeah, I just, a lot of has been said, but this kind of, I know it's off topic, but it relates. It kind of reminds me of MA-17 fees for the levies, because there's different areas that are paying for the maintenance of the levies or something of that nature. So it's kind of just in a way reminds me of that. I don't know how far off base I am, but just wanted to state that.
Okay, thank you very much, Supervisor Crandall. Bridget?
Yeah, I just have a couple of questions. You know, and I'm not the legal person here, but is it possible that given the situation that there could be an easement created and that, you know.
Too early to decide that.
Yeah.
Okay.
So, yep.
Because to me, it just seems like it would just solve all of this. I mean, they could, you know, special districts could then just cut off the park if it's violating, if they feel that, they have complete control to manage it. Yeah, I don't know. And we're talking about one manhole and, you know, it's about, what, 50 feet of a lateral.
What's the address of this property?
3075 Lakeshore Boulevard.
Okay, thank you.
And I think what we've been looking for is a path forward here. I know, you know, we could always just have simple solutions. Sometimes there's just a process we've got to go through. Seems like Anita's laid out a process that hopefully that will get answers that you are currently asking at this point for everybody, all involved in this one. And, you know, hopefully we can move down that path.
And Mr. Chair?
Yeah.
I'll make sure the third party administrator knows about this meeting so they can watch this and get up to speed very quickly.
Okay. Thank you, Anita. Jan, I see you put your hand up, and then I'll go to you, Supervisor Spatier.
Yeah,
Go ahead, Jan.
I just wanted to say that we would welcome a third party looking at this and giving us some direction. As Anita has pointed out, there is the problem with gift of public funds. We can't just agree to take on a manhole without a third party saying it's the right thing to do. So we're very much in agreement. We did have an entire presentation about this, but I'm going to ask Scott to hold off on that and let's just wait and let this go through the channels and we will honor whatever that third party investigator determines.
Thank you, Jan. And I think that will give, even for the board and, you know, Anita, as we work these things, let's get that resolved and then we can come back and have some more discussions. Supervisor Sabatier?
Yeah, I was going to ask, since trailer parks are the state's business, obviously this would go through either the city or the county for approval to get things going, but as far as the inspection of the work that was done, would that be only through HCD or would that be through the city or the county?
Are you asking Jan or?
I'm asking anybody who might have the answer, because I think that if it's the state that says, yes, this is approved as it was intended, because a map is a map, but the reality is it could definitely be different than a map, and it should be based on who approved the reality and not just who approved the map, because I know that we've had some issues, whether it's the city of Clear Lake or the county, where the map looked great, everything was signed off, but what was actually constructed went a little bit off design, and therefore the map is no longer, unless approved, the map is no longer exactly what we're looking at and dealing with, because the situation is definitely a unique situation. I wouldn't want to be responsible for someone else's sewage pipeline in my property. I think that should be separated, but obviously that is not the case currently. There's 3 different properties attached to one, and we're asking, or somebody is kind of raising their hand saying, why am I responsible for all of the other people's connections to this one pipeline? And so we got to figure this out. But I'd like to go back to the point of who approved the actual construction. Was that the state? Was that the county, city? I'm not quite sure.
The county. It was the county. The state, they won't even give us a permit without the county, or it was the city of Lakeport at the time.
But a permit is one thing, but who did the inspection?
It would be the county today.
A permit is one thing, but who did the final inspection? Was that the state, since it's supposed to happen on...
No. State doesn't even look at it. They look at what the county approves, well, it was City of Lakeport, now it's the county, right? So they would have the county manage this, do the connections, whatever the county wants, and as long as they agree and approve to it, the state signs off on it, and then we have our permit to operate. But no, they don't touch municipal lines.
But as far as the final inspection, I'm not talking about the approvals of the process to get to the part of actually doing construction, but who approved saying, hey, I inspected the construction, everything. I mean, you can't just build a house and have blueprints and that's it.
I think it's county civil engineers. Well, it was City of Lakeport.
It would have been the City of Lakeport doing that when it was installed back then. I don't know. Jan did have her hand up a few minutes ago.
Brian Martin, city engineer.
Yeah, it was Brian C. Martin, city engineer, on 21181.
And also stamped by state.
And it, it has the civil stamp, but it's city at the time is the one who approved all the plans and the final inspection in 1981.
Approved, yeah, by city.
And this is why, we always have these discussions with Jan or anybody else when we're taking in a system of this kind. There are always, these are the problems that we can inherit when we're doing these things. So, what I would like to ask of you, Bridget, and what we want to do is get to a resolution. I think a path has been laid out by Anita as we move through with that. Ultimately, there are a lot of unanswered questions that have been addressed today, but I think the starting point would be to really try and get this thing to a resolution where we can have some serious discussion, where all the information is available for us, is to convene the damages part, where we can get the third party in here to really make some recommendations as we move forward. And I think that would give us as a board also the ability to come up with solutions and move forward in that direction. Ultimately, that's what's been suggested by Anita for our best path forward. And I think we should try and move down that path, and obviously staying in contact with Supervisor Scott. You have had your presentation here, and I think we have, the ability to move forward in a positive direction from today.
Okay. And Anita, I think I have your contact information, because you said last time there was a form or something you could send me. Or how, I've never filed a claim before with Lake County, so is it on your
website? The claim is actually available from the clerk of the board, but I'll make sure we get one out to you right away. I'm sure the clerk of the board's on the call, so she'll make sure.
Okay, I appreciate it.
Yeah. Thank you, Bridget. Supervisor Crandall?
Yeah, I'm just, and they might have said it, but I'm not clear who the gentleman was speaking and giving us the presentation on the old map. I just didn't get his name for the record for myself.
So that's my husband, Tomek Pishek.
Okay.
He's also owner of the park, so we both own the park equally.
Okay,
I didn't see it in the paperwork, and so my fault.
No problem.
Okay, are there any more questions from the board at this point? If not, we'll go ahead and open it up for public comment on this item. I don't see any hands up. Jake, can you open the room?
Yes, I will open the room here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, hearing none, we'll go ahead and close up the room. Supervisor Sabatier, do we have anyone for public comment in the boardroom?
I do not see anybody that looks like they want to make a comment on this.
Okay. All right, then we'll go ahead and close public comment, and yeah, we'll bring it back to the board. Okay, Bridget, go ahead. One last final comment.
Yeah, I don't know how long this process takes with filing damages, but I guess, is there any plan on what I'm supposed to do in the meantime if it backs up? Like if we have power outages, that always seems to cause problems since we don't have generators set up on the pump station. I don't know.
At this point, I don't have a need on how quickly this will move, but it sounds like we're going to try and make this a priority so we can get moving in the right direction. And I also see Janet Coppinger. Jan, go ahead.
Hey, yes, we want to speak on the subject of those lift stations, but it's the Zoom is not allowing Scott Harder to raise his hand or become unmuted. If you could unmute Scott Harder, he could clarify some issues on that lift station.
I'm unmuted now. Can you hear me?
Yes.
Yes.
Thank you. Yeah, just wanted to touch base on the lift stations. We do have rotating generators, and those lift stations operate by having a wet wheel which fills up with sewer, and then there's a sensor in there, and when it gets to a certain level, it pumps it down. So we rotate the generators through. We have a large mobile fleet of generators. We maintain over 60 lift stations. We cannot have stationary generators at all of them, but we are able to respond timely and pump that down before it surcharges the system any more than it would normally in normal operation where the wet well comes up. We have an additional bonus on this lift station in that when it was designed, it actually has a high bypass that flows via gravity. Gravity flow isn't a worse way of flowing. It's the way most of the sanitary system works. In this case, it creates about a 2.5 to 3 foot surcharge within the system behind there, but it doesn't push stuff back into the system and into the laterals and into the private property. All it does is it's flowing slower at that point, and so it builds up. Once it reaches that outlet, it's still flowing at the same rate that it was previously. The pipes haven't shrunk down, they're moving forward and flowing. So the surcharge in the system at that pump station is not what's creating the on-site private system to have fog, fats, oils, and grease. That's coming from the customers in there that are dumping inappropriate stuff down the sewer. So just wanted to clarify the operation of that lift station.
Okay. Yes, Bridget.
So, yeah, this was the explanation we got before, and I guess we just have conflicting reports because Roto-Rooter told us something completely different, and that it was backing up every time it shuts down, and the last one is a proof where they couldn't clear it because the other one, both of the manholes were full. I can send you guys their full report if you need it. And then even after the pump station started working and they had completely cleared our line, 2 days later, they had to come back again and unplug our line. So when their pump station goes down, it didn't clog our line, why did they have to come back again after it was already cleared and flowing and then clear it, 2 days later? So, and it's all in the reports. So all I can say is I'm not an engineer, I'm not an expert. I'm just hearing one opinion over here and another opinion. And, from people in the industry, doing this every day. And this is why I actually do want to get out of it and out of having to manage this, because now I've got Roto-Rooter also in this and having disagreements and arguments and nasty comments, and so it's ugly. It's really ugly.
Yeah, so I think we have a path forward, and so we'll start that. We'll get you the claim form, and we'll get that started, and hopefully this will allow us to get to a resolution. So, hopefully we can start that positive step forward in this process, and then be able to have more discussions when more information is available for all. So we have that third party out there because we are going to have different opinions on each side. So I think this is a good path forward, and we'll get you that information and go from there. Any more questions from the board at this point or comments? Okay, seeing none. We'll make sure we get you that form, Bridget, and please stay in contact with Supervisor Scott as we move through the process. So thank you, Bridget.
Thank you. Thank you, everyone.
Thank you. Okay, how are we doing on comfort break here? How's everyone doing from the board? Just want to make sure if we need time for a break here. I think moving forward with timing, obviously, what I would like to do is, get through these next two items and then try and take a 1 hour lunch break. Hopefully we can get through them before 12:30 or 12:15, and then we'll just take a 1 hour lunch break. I know that may push back our 1 p.m. Item in the afternoon, but depending what it is, what I'd like to do is an hour break. So if we end at 1:15 or 12:15, we'd start our economic development at 1:15. So I'm going to go ahead and move along with the agenda here. Seeing no one raising a hand for break, we'll go ahead and move on to item 7.2, consideration of agreement between the County of Lake, Elijah House for temporary COVID-19 homeless shelter, operations of a contract maximum of $234,550. And this will be presented by Todd Metcalf of Behavioral Health. Go ahead, Todd, you're still on mute. Can you unmute him, Jake?
There we go.
Excellent.
Well, you'll be happy to know that I actually scripted this out in the interest of time, so I will go as quickly as possible. So good morning. It is still morning, Mr. Chair, members of the board. My name is Todd Metcalf, and I'm the director of the Behavioral Health Services Department. And thank you for allowing me some time to discuss this particular agenda item. So what you have before you today is an agreement for the temporary operation of a COVID-19 shelter to be housed in the old juvenile hall facility in Lakeport. This agreement is a result of a request for proposals that went out a few weeks ago. So we had one person that responded, and as you can see, the sole bidder is Elijah House, which is a nonprofit organization based in Oroville, who provides substance use disorder and mental health services, along with operating a residential sober living facility, also over in Butte County, which lends itself well to operating this particular COVID-19 shelter. So if this agreement is approved, Elijah House will assume operations of the existing COVID-19 shelter in Lakeport when the shelter closes on July 31st. And they are offering to assist in the transition of guests from the existing shelter to the new shelter location at the old juvenile hall facility. This agreement before you does end on September 30th because the plan then is to transfer guests from the old juvenile hall to Hope Center, a transitional housing facility located in the city of Lakeport that is slated to open its doors in late September, early October. So as you hopefully have seen in the agreement, we incorporated language in the agreement outlining the term option to extend on a month-to-month basis, just in case Hope Center's opening schedule might change. So with that, and if you've read through the agreement and read through the memo, I'm asking the board to approve and authorize the board chair to sign this agreement. But I'm sure there will be questions, so I'm ready.
Thank you, Todd. Okay, are there questions from the board? Supervisor Scott?
I don't have any questions. I would just like to thank Todd for working incredibly hard on this contract and getting it through. We were also concerned about having this population just be put on the street after we have stabilized them. They've actually housed, I think, like 22 of our friends that find themselves homeless. They found them jobs. They're doing amazing work, and I would love to see this continue. I've had the opportunity to meet with some of the directors from Elijah House, And if we can get their programs into Lake County, it would definitely benefit not just this COVID center, but the entire county to bring services. And it's a game changer here. And it's just really exciting to see that they are looking to come into our county and help us with the many issues that we know that we have here. So thank you.
Thank you, Supervisor Scott. I know Supervisor Crandall, go ahead. You had your hand up. Sorry about that, Eddie. Supervisor Sabatier.
Yes, thank you. I spoke a little bit, or I emailed Director Metcalf over the weekend after reviewing this contract. It's not a huge make or break for me, but it's still something that I think is something to bring up as we try to make sure that we keep our facilities safe. And in Section 2, under County Responsibilities, letter C, Maintenance, Repair, and Replacement, it says that the county shall be responsible for the maintenance, repair, and when applicable, the replacement. And I want to say, unless there's negligence involved, and I just, we're inviting the public to be there. We're inviting a contractor to be there. I think we should be responsible for our building, for the wear and tear, the normal wear and tear of any building being used. But if there's absolute negligence and there's something that happens, we shouldn't have to flip that bill. I'm a little concerned about that, especially, and I'm going to say things that I'm not even comfortable saying, but we're dealing with people who might have some mental health issues. We're dealing with people who might have not be used to that type of situation to be in that facility, and I just want to make sure that that we are keeping ourselves safe from funding something we shouldn't have to fund, and also making sure that we're putting that responsibility and onus on the contractor to make sure not to be negligent in the use of that facility. And I do notice that it's already been signed by the CEO of the Elijah House, and also kind of curious as to how this might change if we made a change in that portion of the contract. I will, before getting an answer on that, I will say that I do have some heartfelt disappointments that this is now being directly linked to Hope Center in Clear Lake. There needs to be something on all sides of the lake to help. The homeless problem is not a problem to be solved in one area. It's a problem to be solved everywhere in our county. And I sure hope that, even though this is to make it simplified, because of the limitations and funds that we currently have for using this as a COVID-19 shelter, that we will still continue to push ahead to make sure that we have something more permanent up in the northern shores or in the Lakeport region to offer that kind of facility as well. I'm not against the facilities happening in Lower Lake or in Clear Lake, but I think that we need to spread those types of programs all around.
Okay, thank you, Supervisor Sabatier. I don't know, Todd, if you have any comments?
And thank you, Supervisor Sabatier. Yes, you and I did communicate about that negligence piece. I can't speak to that because an attorney, maybe Anita Grant, might want to check.
Go ahead, Anita.
You could just simply add language, the contractor would have to initial it since already been signed, but you could put unless caused by the negligence of the contractor in its operation of this facility under the terms of this agreement.
And I believe the contractor might be on the line too, so.
Yeah, I don't know if they are or not.
Yeah, I was just given a text that they are on our Zoom.
Well, I do agree with you that, yes, we would like to see something other than Hope Center, but now that's pretty much all we've got. And, you know, we're limited to the funding sources that we have that are linked to COVID-19 activities around homelessness. And of course, you know that our housing continuum of care is working on this. So no, it's not, we are by no means giving up on having more than one location, but for now, this is what we have to work with, and it seems to be the best path to ensure that these folks that are unhoused will have a place to go when the shelter that's closing July 31st, and then this new shelter that will undoubtedly, of course, it's only a temporary operation, will close in September and or October. And again, that was the reason for the month-to-month clause in the contract to keep it going needed until we need to close it.
Denise, I see Denise Pomeroy has her hand up. Denise, go ahead.
Good morning, your board. I just wanted to, from the health department, show our support for this temporary housing. As the board probably remembers, several months ago, we had to do a attestation with the state to show readiness to be able to be open and to stay open, and housing this population was part of that. And so I want to say thank you to all of the work from the members who helped the city, the shelter, Supervisor Scott, Todd, and getting this done so quickly and moving it forward. So this also does help us stay within that variance that we wrote a few months ago. So thank you.
Okay. I don't know, do you know the name of the individual representing the Elijah House? Is it John Mitchell or Mitchell? Do we know?
Yeah. Yes,
Okay, go ahead, John.
Hi, I apologize. I had a little trouble getting in, so I missed the question, but I hear that there may be some changes that need to be made in the contract regarding negligence in the use of the facility, something along those lines. And I know that Joe, who is our actual CEO, he's driving to Clear Lake now. He should be there shortly, but would be available to look at any amendments to the contract and initial whatever may need to be initialed.
Supervisor Sabatier, would you repeat your question since he missed?
Yes, no, I appreciate that Mr. Mitchell is on the line with us today. I was looking over the contract, and it says that the county shall be responsible for the maintenance, repair, and when applicable, the replacement of all infrastructure of the facility and facility grounds. And I just was looking for a negligence clause where that onus would be placed on the contractor rather than the county, just to help seal that deal.
Yeah, absolutely. That's something that we'd be agreeable to. If we caused the damage or what have you, then we would work with the county. Since it is a county building, we would work with the county to make the necessary repairs. So we would not be against that kind of language in the agreement.
I appreciate that. And I figured that it wouldn't be too large of a problem since you do have the clause in here also about the insurance. And so that would help take care of it as well.
Okay, are there any other questions or comments at this point from the board? Okay, yes, Supervisor Sabatier.
And just one last thing is, as we proceed, I'd be very interested, since this will be used, this is a county facility that will be used for this program, to receive program processes, protocols, so we can have a better understanding of how this program is being run, because I think it's a good opportunity for us to learn and see what the results are, to see how it is that we move forward in the future as well. So if those things can be shared as they are created and finalized, that would be great.
Thank you very much, Supervisor. Okay, if there are no more questions from the board, we'll go ahead and open this up to public comment. I don't see any hands up. Jake, can you open the room? Oh, we do. We have a hand up. John Mitchell.
Hi, good afternoon. I just wanted to thank you first and foremost just for considering our proposal that we've put before you here today, for the opportunity to come into Lake County and provide some of these much needed services within your region. And, you know, there is definitely, I'd say, a short-term goal within this proposal itself, but just want to let you know that as the Elijah House, that, you know, our goal, we've been working on this for a little while, building some relationships and networking within Lake County to come and provide some much-needed services in that region already. And so we do have some long-term goals outside of this grant proposal that we are currently working on as well. And so we just really, you know, saw this as an opportunity for us to come in and meet a given need within the community, and to be able to, you know, provide some of those services and that we already offer, hopefully in conjunction with what this proposal is asking for in regards to COVID-19. We have been working with a lot of the teams that have already been in place in that county with the Hope Center and Adventist Health and those who have been operating the COVID shelter so far. And our intentions are to keep a lot of these people on board that are already been running the shelter. They've been doing an amazing job there, just being within the industry, and I've seen some of their results in housing and employment and such. I really think that within a couple of months even, there could be a lot more success from this program. So just wanted to thank you once again for offering us the time today.
John, thank you very much. Go ahead, Todd.
And I just want to echo that, because this I see is a great opportunity to bring additional programs and services in that will support what behavioral health services is already trying to accomplish. So I'm excited about this. I really have to say that I believe this is a win-win situation, although temporary, but I believe we're moving in the right direction here. So I'm excited about this.
Okay, thank you very much, Todd. Okay, Jake, let's go to the next hand up.
All right, the next hand we have up is Brad Rasmussen.
Welcome, Brad. Go ahead.
Brad, I've sent you a mute request here. You should be able to unmute your microphone now. All right. The next hand we have up is Brad Rasmussen. Looks like we're getting an echo. Are you watching on?
Can you hear me?
Yes.
Thank you, Mr. Chair and Board of Supervisors. I just wanted to quickly state on behalf of the city and the police department that we believe this is a very robust proposal to bring in a good quality company to expand the services. We want to thank the United Christian Parish, or I'm sorry, I think I'm getting that, Kelseyville Methodist, and the Hope Harbor, the health department, and the staff down there at the current shelter. They've done a lot of great work, and it's very critical that we get this proposal approved and moving forward so that there's no break in service. It would be detrimental if the folks that are currently in the shelter had to go back on the street. So I appreciate the board and the county looking at this quickly. That's it. Thank you.
Thank you, Brad. Jake, can we please go to the next hand up?
Yes, looks like the next hand up we have is from Pastor Shannon.
Oh, can you hear me?
Yes, Pastor Shannon.
Okay, marvelous. I wanted to begin by saying thank you to Bruno, who really opened up this idea.
Pastor Shannon, can you please state your name and who you're with? Sorry.
Pastor Shannon, Project Restoration, Adventist Health.
Thank you.
Okay, I wanted to start by thanking Bruno, who really opened up the idea of potentially using the juvenile hall facility for this project. And thank you to Todd Metcalf, who did an extraordinary amount of work to get the contracts and proposals done so that there was at least the possibility of continuing operations without a break in service. Chief Rasmussen is, I'm 100% in agreement with you that it would defeat a lot of the remarkable work that our team at Hope Harbor has been able to achieve in the last 6 months if we were forced to have a break in service. So I just wanted to start with those thank yous. And then I wanted to speak briefly to Supervisor Bruno's comment about being disappointed that the contract was tied to Hope Harbor. And I wanted to express that I felt that same disappointment with an exception. I do believe that we need a two-site solution. It is not reasonable to expect one city and the lake to solve the homeless crisis for the entire county. So I really want to emphasize that not only because we are at a crisis level, we need more than one site, but also because we need those numbers up to support our COVID variants and the number of beds that we have available. What heartened me in terms of mentioning Hope Center in the contract is that how I interpreted that, and somebody can correct me if I'm wrong, but that it means that the juvenile hall facility is at a minimum being offered until there is at least one other option. It doesn't mean it has to end at that point, but it means that it won't be closed until Hope Center is open. And I think that that is, again, critically important. So I just wanted to ask that little clarifying piece. And thank you, everybody, because it took a tremendous amount of work from a lot of folks from behavioral health, Hope Harbor, Department of Social Services, the County Board of Supervisors to pull this together. And I believe that bringing Elijah House to Lake County, I'll just echo what Supervisor Tina said, it is an extraordinary opportunity for Lake County and the services that we are able to offer people experiencing homelessness. So thank you to the whole team.
Thank you, Pastor Shannon. Okay, I don't see any other hands up. Jake, can we open the room?
Yeah, I will unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, hearing none, go ahead and close the room. Do we have anyone in the boardroom that would like to make a comment on this item?
It does not appear anyone will be making a comment on this.
Okay, with that, we'll go ahead and bring it back to the board for action. Go ahead, Supervisor Sabatier.
I have a question. It's related to this, and it's the point in time count. Does the point in time count have to happen in January, or can it happen anytime that we deem it necessary? Because I see here that we're about to bring on a partner who really could benefit by ensuring that we have the right point in time count, and that can expand our efforts to make sure we get the right number, and that number equates into dollars specifically for homeless programs. Wondering if that's something that we can look at, because the contract again does end at the September 30th, but at the same time does have a month to month to keep going, but it's limited in the number of funds that we have. For instance, their contract spells out 15 weeks, which would take all the funds that we have currently. So just wondering if that's something that we can use to our advantage while we're kind of on a timeline. And because the more we can access those funds, the quicker we can access those funds, the better off we can be in the continuity of what these programs are.
Okay, I don't know who could answer that. Supervisor Scott?
I would have either Todd or Pastor Shannon answer that question, but yes,
Okay.
we have to stick with that date that we're given.
Okay.
She has her hand raised.
Go ahead, Todd.
There we go. Well, I don't mean to disagree with you, Supervisor Scott, but about a year or so ago, I was told that we could actually do 2 different point in time counts during the year. It's just we're sort of stuck in a, this is the way we've always done it mode. So I was told we could do one in January like we normally do, and then perhaps another one in the summer, just to try to come up with a more accurate count. And I'm totally open to that. Though I don't sit on the COC board anymore, and I don't mean to speak for them, but that was my understanding a few months ago, that we could perform more than one point in time count.
Okay, I did see that Pastor Shannon had her hand up too. Pastor Shannon?
Yes,
Go ahead.
can you hear me?
Yes.
Okay, so the answer is yes and no. No, we cannot do more than one official point in time count. Only the January count can be used for HUD official purposes. We can use funding from the COC to do a summer point in time count, but we cannot report those numbers as our official numbers. It is that secondary count is only to help communities identify their need, but it's not our official number. So it's both and then in terms of how does Elijah House, which is a fantastic organization, relate to the point in time count, it really does not, because the point in time count is a function of the continuum of care, and we all persons and agencies in the county can be a partner in that, but it is run by the continuum of care, and they are the ones that bear the responsibility for reporting to the federal government.
Thank you for that clarification, Pastor Shannon. I do see there is a second hand up. I don't know, I can't see the name. Jake, can you Is it someone that is directly related to the homeless, the point in time count?
It looks like the individual's name is Linda Hedstrom.
Yes. Okay, I'm seeing a yes from Todd, so I don't know if Linda had anything else to add to that question.
Hi, can you hear me?
Yes.
I'm Linda Hedstrom, a District 4 resident and an affordable housing consultant. People seem to get stuck on the point in time count, which is a single-use function with HUD for just very certain kinds of funding. Most HUD funding does not rely on the point in time count. We certainly have a lot of other studies, including behavioral health's recent No Place in Home study, which included homeless counts. And Pastor Shannon has been involved in some excellent studies out of Adventist Health that counts other homeless populations at different times in different ways. The point in time doesn't allow us to count, for example, couch surfers or people doubling up or tripling up in units, which technically also meet other HUD definitions for homeless. So there are lots of other funding sources available for what Pastor Shannon is doing and what Elijah House can do. And we don't have to think in terms of that once every other year point in time count for those.
Thank you, Linda. Okay, go ahead and bring this back to the board for action.
Mr. Chair, I move to approve the agreement between County of Lake and Elijah House for temporary COVID-19 shelter operations for fiscal year 2020-2021 for contract maximum of $234,550 and authorize the chair to sign the agreement.
Would you like?
Would that be with the amendment that was recommended by Supervisor Sabatier?
With the amendment.
Second.
Anita, go ahead.
No, you beat me to it, sir. That's all I needed.
All right. Excellent. Okay, is there a second?
Second.
Seconded by Supervisor Sabatier. Can we please do the roll call vote?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Thank you very much, Todd. Thank you, everyone. You can move through item 7.3. Sitting as the Lake County Sanitation District, consideration of a change order number 1 with Mercer Fraser Company for Anderson Springs Sewer Project for an increase of $23,688 and a revised contract amount of $1,950,683 and authorize the board chair to execute. I think this will be presented by Jan or Scott. Do we have Jan or Scott on?
Okay, there, can you hear me now? Okay.
Yes, we can hear you, Jan. Go ahead.
So, as you know, Mercer Fraser Company has the contract to install the on-site work at Anderson Springs, the grinder pump and the wet well and communication electrical systems. Every single parcel was different, and some had greater challenges and work that was required outside the work that was bid. Each of these exceptions we would meet and go over, and that would include the engineer, the on-site inspector, the contractor, and myself, and we would agree to what was required in a price and move forward, rather than bringing you 11 change orders throughout, being here every week. We waited, tracked them, and this request involves all the additional changes that were required. There was 11 variations, and the $23,688 is a total of all 11 systems. And some, it was major rocks we ran into. Some needed a longer line. there was just a variety of changes, but to keep everything moving quickly, this is how we decided to present this. So I'm here to ask you to consider this change order for $23,688, bringing the revised contract to $1,950,683, and authorize the chair to execute it. This is fully grant funded, and the funds are there to cover this change order.
Okay, thank you very much for that explanation. I know that, are there any questions from the board? Supervisor Sabatier?
I just want to give kudos. I love seeing these type of agenda items with the level of detail that comes with it. There's just zero questions left over. It's very specific as to what happened and why you're asking for a change in the contract amount. Just really appreciate the level of professionalism here.
Thank you.
Okay, any more questions? Okay, we'll go ahead and open this up to public comment. Jake, go ahead and open the room because I don't see any hands up.
Yes, okay, I will open the room here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, hearing none, go ahead and close the room. Do we have anyone that would like to make public comment in the boardroom? Hearing none at this time. Vice Chair Sabatier, no one is moving to make public comment at this point?
No, I do not see any movement.
Okay, thank you. All right, we'll go ahead and bring this back to the board for action. And I know this is in my district, but if someone would please make that motion, greatly appreciate it.
Not a problem, Mr. Chair. I move to approve change order number 1 with Mercer Fraser Company for Anderson Springs Sewer Project for an increase of $23,688 and a revised contract amount of $1,950,683 and authorize board chair to execute.
Is there a second? Thank you, Supervisor Scott. There's a motion and a second. Can you please do the roll call, Johanna?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Okay, who made the comment?
Oh, I just said thank you.
Okay, thank you, Jan. Moving forward, like I said on our agenda, what I would like to do is take a 1 hour lunch recess. That would put us back here at basically, let's just say 1:30. Would we be able to communicate that with the department heads, Carol?
I sure will.
Okay. All right. Thank you very much. We'll be on a lunch break till 1:30 and we'll reconvene at that time. Welcome. We'd like to reconvene the July 28th Board of Supervisors meeting. We are going to start at 1:31 p.m. and our agenda item 6.4. This is our 4th Economic Development Workshop with county department heads. We'll go ahead and turn it over to Carol at this point. I don't know what order we have going on, but we'll go ahead and turn it over to County Administrator.
Thank you, Mr. Chair. I'm going to do a very quick share screen. So as you well know, this is the 4th in a series of 4 economic development workshops with your department heads that began as an idea that came out of a economic development workshop you had back in January with the board and all department heads. And it was determined that we would proceed in this manner with department heads coming together in similar groups. Today you have before you what I'm referring to as the Health and Human Services group. These are the department heads that primarily serve our vulnerable populations. Certainly they serve children, they serve seniors, and then adults as well who have needs. And it's certainly no secret that the well-being of our citizens in our communities is yet another form of economic, another driver of our local economic development, the well-being of our citizens. So at that January workshop, your board zeroed in on some priorities for economic development, and I'm showing you the first screen with those on it, and in just a moment I'll move to the next one. I'm not going to read each one because you've seen them 4 times in a row, but it just is a reminder in terms of what our intention here is. And following today's workshop, the next step we hope your board will take is to actually form a long-term group, an economic development task force comprised of department heads and key staff that will continue to focus on this important priority for your board in the years to come. So with all of that said, I'd like to turn it over to the 4 department heads. I want to welcome Gail, Todd, Crystal, and Denise, who are each here to review the worksheets and that they submitted in advance of this, and also speak generally about their departments and their role in economic development as they see it. So Todd, since you have your camera on, would you be willing to start?
There we go. Yes, I wouldn't mind starting at all. I know it's been a long time since you've all seen me, what, an hour or so, but so good afternoon, Mr. Chair, members of the board. My name is Todd Metcalf, and I'm the Director of Behavioral Health Services. First, I want to say that I took a look at what I had originally proposed in my economic development proposal, and I basically ended up just reworking my original proposal because I think it was a bit, it wasn't thorough enough, and a lot of this is due to, the recent events around COVID-19. And that said, I would first like to advocate, and though this isn't just about my department, but and I'm gonna get this wrong, I don't know what the policy is called, the county policy about working remotely. I would like to advocate that this policy becomes a permanent policy, not one that gets reviewed every 18 days. Because, since this policy was implemented, our department has shown a noticeable decrease in what we call no-show appointments because of the utilization of telehealth and telephone services. Our clients that had previously been faced with transportation issues and other barriers are now finding it so much easier to engage in services remotely. So on the flip side of that, speaking to the policy, is that our staff is also finding an increase in productivity in the ability to work from home. Working remotely also decreases the need for increased office space, and I believe that would lead to an eventual cost savings in rent and utilities because we're not paying for that space for staff to be housed. I know it's already been mentioned by other department heads, and I think I put it in my initial economic development proposal, but the ability to use debit and credit cards would be a great advantage to our department, mainly around our DUI programs because it's cash only. And it's difficult for some folks to come in with a card and we can't take it. And so I would like to advocate for movement around that as well. So in light of COVID-19, my department, as I'm sure many others, are going to be facing decreases in funding. And I think I've said this before, I'm asking for this board to help advocate at both the state and federal levels to provide and help. We need help with legislative support for our programs and services. I'm on state calls, and I'm just a director of a behavioral health services department. It would put more teeth into it if board members would help advocate. And I know you are. I know you're doing so much. And But it's specifically just for my department, more advocacy on a higher level would be amazing. And the state is allowing my department now, in light of COVID-19, to be able to bill for more services. So that means more revenue for my department. It really is only a temporary stopgap to reduce the impacts of these funding cuts that are coming our way. The County Behavioral Health Directors Association of California had advocated for a $3.3 billion backfill to help offset the cuts coming to realignment funding that is coming to my department. And although we fought for it and we quote unquote won, the $3.3 billion backfill was reduced to $1 billion. I know that sounds like a lot of money, but you spread that out among 15 counties, and it just leaves all of the counties having to provide behavioral health services reduced budgets. And speaking of money, we really, and I know the Class and Compensation Committee is on hold right now, and that's fine, I understand. But we really need to look at bringing staff on at higher pay levels. And, just recently I had a psychiatrist position that had been open for years in my department, but I finally eliminated it because we couldn't fill it because of the pitiful salary that we were paying. And that's just one example. And so with that being said, I'll use the psychiatrist position as an example. So, okay, we can't fill it. So now we have to contract out for those services, which, heck, if we could pay, and I don't have the figure on top of my head, but even if we could pay $50, $75 an hour, which is much higher than what we're paying, or what the pay step is now, we're contracting out for those services to the tune of about $140 to $160 an hour, and again, out of county. So yeah, we're able to provide those services, but if there could be a way that we would be allowed to bring folks in at a higher step level, and not have to contract those services out, which I've talked about before, and I'm going to talk about it here very soon, I think would be a benefit to us. So this leads me to the final part of my presentation, keeping money in Lake County. You've heard me talk about over and over again how much money we spend on contracts to place our clients out of county, which I did some rough figuring before this presentation, and it's close to $2 million a year. And I'm hoping to be able to put together, actually I'm not hoping, I want to put together a work group this fiscal year to figure out a way to develop some kind of a facility, whether it's a crisis residential facility or a low security facility, to bring these folks back to our community. Because I do believe, and I've been in this position for 3.5 years, I still haven't figured it out, but there's got to be a way to bring these people back to the community, along with the monies that we've been paying to house them out of county. I mean, not only would that be an economic development to the county, but I think most importantly, it would be a benefit to the clients, because our clients would be here with their family and friends. Our staff could check on them more, because don't forget, when we place our folks out of county, we're paying for that, paying for our staff to commute out of county, visit, and make the appropriate checkups and visits on our clients. That's more money. So, and I ran just a couple of quick figures here. So if we were to be able to come up with like some kind of a board and care facility for our folks, which we have 8 people right now placed out of county because we don't have capacity for that here. The annual cost for that for my department is $500,000. And if we could somehow figure out a way to open a locked or some kind of a secure facility Right now, we have 9 clients placed out of county, which we're spending almost $1 million a year to house. And I know what I talk about is very lofty, and maybe there isn't a way to make it work, but I have to believe there's got to be a way. You heard me talk earlier today about what we're doing with the Elijah House and the old juvenile hall facility, and I know that's a very short-term thing, but I am not going to stop working on this last bit of stuff I've been talking about, because it pains me to see these contracts and the monies that we're spending, not only on our clients, but as I touched on earlier, because we don't pay enough for staff that we could have on board, we're paying almost 2 to 3 times the amount to provide the mandated services that we need to provide. It comes at a cost, and like I said earlier, I don't have the answers, and I'm looking to this board to help me figure this out. So I'll get off my soapbox, because I know this meeting started late and I don't want to take up all the time because there are other department heads that need to speak, but that's pretty much my presentation. And I know it veered off my original proposal, because when I reread it, it was pretty skimpy. And so I think that's all I've had to say. And thank you for your time, and thank you for listening. And I appreciate already the support that I get from this board and the county overall. So thank you.
Thank you very much, Todd. I know the way we're going to do it, we're going to roll through the presenters and then be here for more specific questions at the end. So thank you very much.
So Crystal is queued up on video, and I wonder if she would go next.
Oh, you're still on mute, Crystal. Jake, can you help her get on mute? There you go.
What about now?
Yeah, you're good.
Okay. So I'm going to echo some of what Todd said. I think that clearly a lot of the things that we're facing right now are countywide, not just specific to our departments, but I think, some of it is worth repeating. So one of those things is the remote work policy. While I realize, it wasn't something that was pre-planned, we were kind of forced into going there, but it has actually ended up to be a very positive thing here. Our productivity looks to be very good. Now we have waivers from the state in some program areas, and so it's not apples to apples necessarily, but I do think what it has shown is that we absolutely are able to accommodate it. And while maybe not at the level that we're doing right now out of necessity, we would be able to do it in certain program areas almost 100%. And so it has benefits that I think, Todd has alluded to, but one of those is the reduction in office space. We pay a ton of money every year in rent for the 5 buildings that we currently are housed in. And we could potentially reduce that significantly and allow us to better use that funding. And then also it's a real morale booster for employees. They really like having that option. And right now, out of our entire staff, we probably have about 40 people, between 40 and 50, that continue to come into the office for things that are necessary, like receiving mail and that kind of stuff, and the fiscal and accounting processes and things like that. But it just has really worked out far better than what I initially thought it might. And so the other advantage is I also think that if we paired that with the ability to apply online for every program that we're able to do that with, we could really reduce cost, even for our customers. So they don't have to come into the office. They're able to apply for services, at least for benefits, online. And some of our programs would not lend themselves to that. But I do think just an overall look at how the county conducts business overall and what we have available on our websites, whether it's the county site or the individual department sites. I think there's a lot of room to grow and improve the availability of our services to the public. So that's an area that I'm really interested in being part of and exploring further post-COVID. Let's see. So one of the things, as Todd mentioned, we are the class and comp implementation of the class and comp recommendations are on hold for now, but I just want to, and I'm likely not saying anything that people don't already know, but we spend so much money on recruiting and training staff that leave. We just cycle through people. And if we could just save that money, we would be able to use it in many different ways, including increasing pay to staff that stay. But it's that churn that costs us an incredible amount of money, takes up an incredible amount of employee time. And I'm really hoping that it won't be too far out in the distant future that we can actually implement some of the recommendations of the class and comp survey. What else do I want to mention? I think, the state under Governor Newsom is putting money down through the different agencies in the state that goes to the counties then. And DSS is one that will be receiving and has received money for housing. We currently have housing support program, which is really geared for people who are already on CalWorks, and it's a housing assistance program that we contract to NCO. Currently, they've housed 52 families, which I think is incredible. And most of those people still have housing. I can't remember the exact number, but it's in the high 40s. So we also will be implementing and contracting out to NCO, the Housing Disability Advocacy Program. And this is for folks who are disabled and need housing and also some assistance to receive SSI benefits. And so they'll be doing both things. They'll be helping them to be approved for SSI and then also to find housing. And so that's an exciting new program that's coming. We're also working with Hope, a collaborative group, Hope Rising, and also behavioral health and public health services. So Todd and Denise are also aligned with and involved with Hope Rising and part of this collective movement to really, and Tina is the chair right now for Hope Rising. But looking at the homelessness in Lake County and how can we meet the needs there. So one of the things that we're doing is looking at bringing to the board a request to submit an application for Project Home Key. Home Key is kind of a follow-up to Project Room Key, which most of you are familiar with. It was for those people high risk, medically high risk, to have their own place to shelter so as not to be exposed to COVID. And while we ended that program, we are interested in applying for Project Home Key, which our plan would be to use that funding to fill the gap that's still needed to open the Hope Center in Clear Lake. And so far with the conversations we've had with the state, our plan is consistent with Home Key. And so we're pretty excited about the possibility of getting that funding. We have a few steps that we need between now and submitting an application, but it's one of those rare examples of having just a great collaborative participation. We have, county departments, we've got Adventist Health and Sutter. The board is represented on Hope Rising. So it's just really a great cross-section of the community who are getting together and saying, yeah, this is worthwhile, and let's just, whatever we have to do to get it done, let's do it. And so really hopeful to fill in the gap there to get Hope Center open and operating. So I'm sure you'll be seeing me soon with a request to submit that proposal. You know, on a less hopeful note, one of the things that I plan to bring to the board soon is just a kind of an update on in-home support services. It continues to be the most significant program in terms of cost at DSS. We're basically compared to caseload wise, a mid-sized county, and we are a small county. And we are just so out of proportion with other counties and states in the cost, other counties within the state with our cost for that program, which is also funded through 1991 realignment. And Todd already mentioned that because of the reduced sales tax revenue this year as a result of COVID, while there is some backfill coming, I am not sure how well we are going to be able to absorb the actual cost of IHSS. While we would be able to do it this year, it can't be sustained like this, and I will be asking the board in the very near future to help us with some legislative advocacy to really look at the unique situation that Lake County is in and how inadequate the funding methodology is to really meet that need. I'll just give you a couple of quick facts about it. So population size in 2019 was 64,665 people. And the number of people that we had on IHSS was 2,186 with a cost to DSS of $6,128,631. The next, Tehama County with 63,000 people, so really literally just 1,000 people less, has 1,195 IHSS recipients with a cost of $2,140,000. And I'll give you more of these facts in an actual written document soon, but it's really unsustainable at this point. As you well know, we've been involved in negotiations. The union ended those because we didn't have anything to bargain with. And I don't know, I'm sure those will be reopened at some point in the near future. Right now, though, the percentage of realignment that we are spending on IHSS is 57.5. And the closest county to that is San Luis Obispo with a much larger population, over 3 times our size. And they're only spending 47.97%. So you can see, we're really, we're going to have to develop some kind of a plan for continuing to provide this program. And it's a mandated program. It's an entitlement. We don't actually have that option. So that's a definite concern here at the department. Let's see. I do really appreciate the recent implementation of electronic signatures. I think that will do so much in terms of cutting down the back and forth. We're located down in Lower Lake, and so we do a lot of running back and forth to Lakeport to get signatures from one place and taking them to the other to get the next one and so on. So I really am a big fan of that process as we get kind of the kinks in it worked out. It really does seem to be going well. And I guess, those are really the main things that, I think about when I'm thinking about our sustainability, about county economy. I do think that we have a real lack of affordable housing here in Lake County. I know that's not a surprise, but I think about it in terms of employees finding affordable housing, especially if we were to be recruiting people from outside of the county, which right now isn't really happening too much because, of course, we don't pay commensurate to the counties that are contiguous to Lake County. But for myself, I was not able to find housing initially. And so I know that it continues to be an issue. But even more than that, I'm thinking about it in terms of our clients and where are they living and how can we prevent them from becoming homeless. And I think finally, what I would like to mention is just the ongoing need for disaster planning and response takes an incredible amount of staff time and energy. This year, we started in March, and I know that health services has been the most directly impacted, but DSS has been impacted as well. We've shared in some of the work that Denise has done, and we definitely have made our staff available as disaster service workers. I foresee a problem with getting disaster service workers for wildfire because people, I think there's a level of fear, and I am just concerned overall about the sheltering for this summer. I'll just share a quick fact with you. So our largest shelter that we typically use is Lower Lake High School that has a capacity of 608 individuals. And with using the methodology for sheltering in a congregate shelter in a COVID environment, we will have a capacity of 80 there. So if you think about all of the other shelter sites that we have, which are smaller, it's even fewer than that, which means it will require more staff for more sites. And so we're working with Office of Emergency Services and other disaster partners in the county and the Red Cross to develop some messaging around, sheltering this summer. And when we get involved heavily into the disaster response, our programs suffer. And so, while I know it's coming, it's just something that does end up impacting us on a fiscal level. And I know it definitely impacts the county as well. But those are the things that are on my mind right now. I'm sure there are others. And I'd be happy to talk to anybody further about any of these later today or at any time.
Okay. Crystal, thank you very much for your presentation. I know what I'd like to tell Todd too, if you could hang around, we're going to go through the presentations, and I know board members will have questions. So thank you very much, Crystal.
Mm-hmm.
All right, Mr. Chair, I was going to call on Gail Woodworth at this point, our Child Support Director. Gail, unmute yourself.
Okay, can you hear me?
Yes.
Okay, so I'm Gail Woodworth, the director here at Child Support Services. And as you know, our main jobs here are to establish and enforce child support medical support orders. What's become another huge factor is modifications, and especially with this pandemic, we've had an increase in requests for modifications. So our goal here and what the state has really been trying to roll out is that we all, across all the counties, do the same thing when it comes to establishing and modifying. So they're setting different standards. So there's some new things that we're doing to try to make sure that anywhere across the state that you got a child support order, the same methodology would be used. So part of what we're doing is we've dedicated additional staff to modifications because we feel that having those right-sized orders is what we need to do for both a custodial and the non-custodial parent. It's really been interesting with this pandemic and having teleworking. The texting that the state just enabled us to do not too long ago has really, really worked out well. I've been surprised at how quickly our customers agreed to have their information given to them by text, and emails have also increased greatly. So that has really been helpful as we've had, our staff working either in the office or out of the office. And so those are really the two things that we've been working on, and I think modifications and establishing child support orders are really is what's going to help this county and the people in it, to have that child support funding that they need to have to raise their children. We are facing when we get to budget hearings, you'll see I had a decrease of $369,000. There was a huge cut to child support services at the state level. And the state had actually come up with a budget allocation methodology that they had just started to implement at the beginning of the year. And it was going to be over a 5-year period, getting all the counties what they call equally funded. Well, because of this decrease, we were hit at one of the highest percents. It's a 14% decrease in our funding. Fortunately, we had funds that we weren't spending because we knew that this was coming, and then we decreased a lot of our other expenditures. We really skinnied our budget a lot. But in light of this, it caused us to focus even more on our establishment and modification processes, to streamline those, to re-engineer them, to take a whole new look at them, so that as we went through the establishment process and the modification process, that we were doing things as effective and efficiently as possible. So we've actually surprised ourselves, and we found some really good ways to make those things go quicker and more smoothly, even for our customers who, for a time weren't able to come into our office. One of the things that's really been beneficial, and I really want to say kudos to our courts, we've been able to do Zoom court for all but, I think, the first 2 months. Only the first month. In May and June, in July, we've been doing Zoom court. And it's more work on our end, but it's made us being able to continue to get those orders established and those orders modified. And I listened to other bigger counties, and some of them still do not have child support court. And so I really want to thank the courts, because they've really helped us be able to do our job. That one of the questions was, how can we better serve the public with the services you provide? And I think really for us just doing our job and staying current and having dedicated staff to some of these processes that are the most vital really help us be able to do our best job. And, having the ability, I guess, to telework and to text and things like that have just really enhanced our ability to establish and modify orders quicker. I think that's pretty much it for me.
Excellent, Gail. Thank you very much.
And Mr. Chair, last but not least, we have Denise Pomeroy, our Health Services Director. And Denise, hopefully you can get off mute. Thank you.
Hi, can you hear me?
Yes, Denise.
Okay, thank you. Good afternoon, your board. Thank you for having us here today. A lot of the same for the health department, particularly public health and health administration, has already been discussed with Todd and Crystal. My list, as well, but Todd had already mentioned, was a little skimpy, and I've kind of updated a little bit since we've been in this pandemic for the last several months, and we'll continue to be doing this additional workload for who knows how far to come. One of the big things is telework and electronic updates to systems. I've been a big advocate for this for several years, and it's unfortunate that it took a pandemic to get us here, but I'm extremely grateful for the increased ability of employees to work remotely, including myself on the occasions when I need to. Telehealth, systems to be put in the future. We currently do that with our DOT program in public health and nursing, and we're doing a little bit more of it in our EH with some simple type of inspections where we can do it electronically and monitor it that way. The increase production has been astounding, really. And even myself, when I think about it and talking with my other directors, including the ones on this meeting today, is you almost wish you had to travel so you get a little bit of a break so your brain can have a minute to decompress from the last 3 meetings you just had. And so it definitely has been work producing ability, and our department here is completely in support of it and would love for your board to consider it a permanent fixture within county work life. One of our other goals is we've already been working on it for several years. Public health is almost there to be 100% electronic. Our Veteran Services Office has been 100% electronic for a few years now. EH is about halfway there. Admin is almost there. There's a tiny bit left, and public health is almost there. The ability to be 100% electronic allows us, again, just increase in productivity. You don't have to go looking for that missing file. You don't have to, have clerks filing things back and forth and pulling files. More importantly, when somebody's working on a case, and cases can go from either different coordinators or different nurses, or even an admin between accountants, all the information's right there. So you can just pull up the case and look at the information. You have the notes of the last person who worked on it and the person before that, and what needs to be done, and outcomes and goals, whether it's a patient type case or whether it's a program type case. So really an advocate for that. I'm also, our department has been an advocate for payments online, accepting credit cards. We receive, not so much in public health, there's a little bit there, but we do receive a significant amount of input from the public. When can you receive automatic payments? And then the other piece is, which Crystal and Todd have already talked about, is implementing all of our applications to the best of our ability online. So whether that's for public health or health administration or EH, getting those systems up to where people can come in and sit down at a computer and do it if they don't have the ability, or they could go to the library and link on, or from their home or from their business. Other than more staff, what supports do we need? We need to pay our staff. We need to pay our staff adequately for for the work that they do with like and neighboring counties and comparable counties. I just currently, and your board probably doesn't even know this yet, I've just recently lost 2 directors. During a pandemic, that's not the time when you want to lose directors. And both directors are leaving for higher pay in other areas of work in county. So, the comp and class thing, we've been working through it, and staff were, I still think are excited about it. But, due to COVID and other things, it's been put on hold. Our employees should and always be our biggest asset. They are what we should invest in. We should invest in their training. We should invest in helping them obtain their next level of education to secure that next level with any of our departments. We should assist with their licensing, and they deserve to have comparable pay. I know this is nothing that your board doesn't already know and that your board hasn't already been working on and trying to deal with. And I appreciate everything that the Comp and Class Committee and our CAO, Carol Hutchinson, and her team have been doing on it. But we need staff, right? We're in a pandemic, and I can't hire nurses. I can't hire LVNs. I can't even hire an LVN, because I think our beginning wage for an LVN is like $16 an hour, $15.81. You can go to In-N-Out Burger and make that. Why would you waste a 2-year degree and going through a licensing board of the state to make what you can make at In-N-Out Burger? I'm venting to, the powers that be, but it's a real problem in our county, and it's going to continue keeping our economics and our county departments and our services that we provide to our community struggling until such time that we can bring that into full circle and be adequate with our neighboring and like counties, comparable like counties and cities. We want to provide low-cost children care services to county permanent employees. Some of our services that we provide out to the public not necessarily are provided to our county employees. There are county employees who are on Medi-Cal and partnership and because of the wage that they make. And so we want to up some of our services to assist them. Provide ongoing CEUs, online training. So many of the agencies now across the state are doing online training, and they're figuring it out. And so I talked about it a little bit already, but it so decreases the cost in training, the cost in hotels, and provides the ability for more work to be done locally within our community. To obtain user-friendly, effective program applications. Some of our applications that we work with the state and the feds and even locals, they're very complicated. The program applications are just too cumbersome for the public. And so we are working with those entities and those agencies across the state and locally to simplify. Simple a lot of times is better. They don't need to be this complicated. Finding ways to automate everything we absolutely can. Some of our other stuff is to make our department website more user-friendly, to have better, more timely, accurate data. We get a lot of questions for data, and it's one of the things that our department struggles with, because as the health department, we should have that data. We should know that data. And we don't have all the systems in place so that, our health officer or our director of nursing or myself or even our program coordinators can have that data at the tip of their fingers when a question is asked. So that is a big goal of ours. We do have a small team of 2 working on that now underneath the COVID, but we're hoping to be able to put some more resources to that. We already have our YouTube channel. So some of this stuff has happened due to COVID before. So we have our YouTube, we have our Facebook. Dr. Pace and staff routinely put updates out there. So that is actually a check off my list. We'd like to integrate our health services department and program applications into our other county departments. And I talked a little bit about this with is upgrading our systems or finding a way so that our system can talk to community development and vice versa, or at least they have access into our system so that if a customer is in our office and they're needing something from public health or EH or even from admin or any of our programs, we can help them without them having to leave and go to another office to do one more task. And just really to provide a path of advancement. So many of our positions are a single classification, and Comp and Class I know is working on this, and I know your board is working on it, but I would like to see true career ladders for people who are coming in, maybe they're working with us while they're going through college, and we can provide, if this is the path that you want on, if this is your career, here is the path we can provide you for the next 5, 10, 15, 20 years. And support these people to stay in our county and work for our local government. And disaster planning and response. DSW workers, thank you to all the departments who've helped us. But it is a real concern. We've been doing these disasters. Well, I've been here for 13 years now, so I've been a part of all of them. And staff are tired, and even though they continue to work diligently and a ton of hours, we just don't have enough to go around. And I echo Crystal's concerns with shelters this summer during fires on having the ability to staff that many multiple shelters will be difficult, and we have been in collaboration with OES and DSS and Dr. Pace and Red Cross, and we've been meeting regularly trying to figure out different alternatives, and we will continue to do that, to do the best for our community and our county. And the last, I think, is the collaboration that we've already implemented over the last 2 years. Behavioral health, DSS, the health department, we work routinely on programs, grants, funding, Hope Rising, Hope Center, have this amazing collaborative opportunity that we've been a part of for the last 2 years, which we're seeing some really good outcomes come of that. So just in the last 2 weeks, the work that's been done to get somebody in here to do the juvenile hall, the quarantine site for the homeless shelter, amazing. That would not happen if all of us didn't just come to the table and put our egos at the door and just put everything on the table and come up with solutions. So I'm really proud to be a part of that. Those efforts with my county directors and departments and the CAO office and her staff, Kathy Saderlin. I don't think a lot of the stuff that we do behind the scenes, especially for the health department, really gets noticed very much. And that's probably my fault. I'm not one of those people that really like a lot of attention or even any attention, really. But I guess I'm going to have to get over that and start bringing these things that we're doing to the forefront of your board so that you see them. And I know Dr. Pace was on. I think he wanted to talk a little about staffing and wages. I may have covered it for him, but if he does, I would turn it over to him at this point. Thank you, your board.
Thank you, Denise. Dr. Pace, are you on?
Oh,
there we go. There you go, Dr. Pace.
Hi, thank you. Yes, I'm on. Thank you. I think Denise said everything pretty much. The main thing is we are in a situation that is demands an incredible amount of staff. I mean, I think we know what to do now, and we're fortunately with support from the other departments and now some volunteers in the community, we are kind of managing. But if the situation increases and the demand is a lot higher, we're going to really have a lot of trouble in protecting the community in the way that we would like to. For example, Sonoma County, which is, I don't know, 8 times the size of Lake County, they have 100 contact tracers at this point that they're paying, and we're not in that situation. We are, working the kind of pushing the staff as hard as we can. Most of them are working 6-7 days a week, a lot of overtime, and bringing in volunteers. So, I think it's just from a point of view of investing in the infrastructure for the health department, it's just a really important step between the disasters and the with fires and evacuation shelters, and also with this COVID crisis. So, you hear me talk about this a lot, and I think Denise covered it really well. But I think it's just something that really, for the ongoing future, we are going to be needing a significantly higher staff just to manage the situation as it emerges. So that's probably all for now.
Thank you, Dr. Pace. Carol?
Well, that completes the department head's presentation, so would just be the time to open it up for discussion.
Okay, we'll go ahead and open it up to the board for discussion. Supervisor Scott?
Thank you, Mr. Chair. I first would like just to say that I've been very fortunate to work very closely with Todd, Crystal, and Denise, and I just want to thank them for their collaborative effort to provide services to our community and, looking for better outcomes. And with that, I love Todd's idea of trying to find a way to bring our people home. He mentioned he has $1.5 million that goes out of our community to take care of our community members. And I think that's something that we should bring back to a board and put a committee together to try to figure out how we can make that happen. I mean, we're already spending the money, so let's try to figure out how we can keep that here. I mean, that looks like it would be an economic development or benefit for our community. So I like to see that come back. Crystal, I have a question for you. I know you were talking about, programs online, being able to, get them online. I've been working with some of the clients at the Hope Harbor Warming Center with the CalFresh benefits, and I've been going online, filling out the forms there, but I've been told by some of the employees there that the paper copies actually get processed faster. Is that correct, or?
Well, I don't know, but I will most certainly check for you.
Okay, because I've been going online because I like the idea of getting online, and it just seems like it's done and paper can get lost and shuffled.
Yeah. Were those local DSS employees that said?
No, it was staff at the warming center.
Oh, okay, yeah. So I'll look into it.
They gave me a stack of paper and said, "No, you're supposed to be using these," and I'm like, "Oh, I've been doing it online," because I find that very convenient.
That's kind of in conflict with what we talk about here, which staff seem to really prefer and really market the whole, concept that people can serve themselves. They can apply online. It's all there right now. I know that not everyone in Lake County has access to the internet, but it really, I would really question that. So I'll find out and let you know.
Okay. And I have to say though, that online application, it is incredibly easy and easy to follow, and the boxes are big, and the color, just having the different colors really helps be able to navigate that. So I can see how clients would find that incredibly helpful. Just some of the themes that I saw today, which we have seen in our other economic development workshops, is automation. So I think that's something we also need to bring, when we bring this back to the board, trying to, talk this out and see what we need to do. Credit cards and work from home. I know work from home, we were forced into that as a county, but I definitely have seen the benefit and would also like to see this continue. I know for myself, I I think I do join in on more meetings because I can just go from meeting to meeting to meeting without having that travel time. And I do agree sometimes, having that travel time would be beneficial to be able to calm your brain down before going to the next meeting. But I definitely find that I'm able to sit in more meetings. I would like to see that continue. And that's really all that I have. Thank you.
Thank you, Supervisor Scott. Supervisor Sabatier?
Yes, thank you very much to our department heads for their presentations today. I'm just going to hit on a few key topics, but I want to start off with where we came from and where we're going first. We started this conversation back in January, and even in our original conversation, we talked about some ideas of things to do that we as a board said, we're not going to do that. And one of those things was remote work. Yet here we are. And I think that when we move forward and we look at doing this ad hoc committee, we need to be our own devil's advocate to ideas that we don't feel comfortable with, because we need to really have the pros and cons of, are we saying no because we're not used to it or we're not comfortable with it, or are we saying no because it's not really going to work for us at all? And I think that if we throw out those ideas, we're hearing that it's actually a benefit to us, then we're not going to move in the direction that we need to go. And I really feel we need to go in that uncomfortable space that we're hesitant to walk into to really see what does the future hold for us. And I hope that's the way that we move forward with this ad hoc committee. I know we're talking about credit cards. To me, credit cards is just a fraction of accessibility. It creates problems, it creates efficiencies, but it's definitely not the answer to economic development. It's a factor that can help with certain activities, but it's not going to make new businesses pop up. It's not going to create new tax revenues, and that's what we really need to be looking at. I've been talking with Director Metcalf and also Director Marketan multiple times about keeping contracts local. That's money that could be spent right here in our community, that pay for employees that are possibly right here in our community, meaning that that will be money that will be spent right here in our community that we can recollect again via taxes. The more we send that money out, the less we're going to see any percentage of that ever coming back into our coffers. And I think it's only smart of us to figure out how to make those big ticket items become a local expenditure and not an out-of-county expenditure. Right now, I'm working with Las Positas Community College to see if we can get that $1 million contract to come over here to Lake County at one of our community colleges, and all the way down to just the $15,000 contract we signed the other day with managing our HCD loans that we have out there. I think every one of them is just as important to try to keep that money here, and we have so much that is going away, and I think it's the hard work to figure out how to make that possible here is going to be so much more valuable than the hard work it takes, because then that'll lead us into a future of making that money stay right here. What I like about today's conversation is we're talking with our human services sector of our county, and I think that the human services sector gives us a baseline that we need to make sure we have the right data to work with to understand how we are moving in our economic development. Because economic development is just not are we collecting taxes, is the quality of life for Lake County changing? And that's what we really need to focus on. A lot of times, it's not just economic development, it's a little bit of both. And if we're not changing the quality of life for those that live here, and we're still seeing the same baseline numbers coming from social services, behavioral health, child support services, or public health, then we're not making that critical change, because we're almost masking the numbers to benefit one area, but not actually benefit who we actually serve and work for right here. And I'm going to say something that's possibly going to have a lot of blowback, and I mean this in the kindest of ways. Investing in our employees should come secondary to investing in our communities. And in order to invest properly into our communities, we need to make sure that we're treating our employees correctly. Because our first and foremost priority is to do work to better our communities, and then figuring out how is it that we're going to get that work done, which is investing in our employees. So I would love to continue some of those conversations, and I hope that we do so sooner than later. We mentioned IHSS and, of course, our low wages. If we increase, and this is just a superficial conversation, but if we increase those wages, that raises our house income level, which makes us more attractive for new businesses to want to come here and settle when they see that there's more disposable income. If we don't take care of some of those simple things, again, it's money that could come back to us because we're giving it to people in our community to spend back in our community. So I think those are conversations that we need to have, a strategic path of where we're going into the future, rather than looking at what the issue is today. We got to look forward to tomorrow. Remote work. I love the remote work, but I'm going to throw a huge wrench in that wheel, which is, what do we do with PSPS and remote work? We've worked so hard to bring generators to our main offices, and now we have many of our workers out at home where PSPS happens, which in last year, a lot of it was entire county-wide. We're being told it should be less this year, but let's see it in order to believe it. But how is that going to impact us with so much remote work happening? I love the idea of remote work. I truly believe that there's a benefit to not having to pay for all overhead costs, of keeping the climate correct, of making sure that everything stays clean. It's just there's a huge benefit that I believe in. But at the same time, PSPS, I think, might throw a wrench for us that we need to be prepared for, especially if our office space is not prepared for an influx of coworkers and trying to maintain social distancing and whatnot. I think one of the most important things, and I'm just to go back over it, the departments we're talking to right here should be the foundation of our data of how it is that our economic development is truly working out for us. And I think that so far, while I have gotten some information from some of the departments, I still feel we're not getting the entire data of how are we truly moving along with the programs that we are paying for and serving the community with. Because that I want to see us. Our goal should be to decrease the dependency on these programs and increase the efficiency and effectiveness of these programs. And some of that should be looking at maybe a human services grant writer. I mean, we're talking about how there's so much money left over on the table, and maybe, I know I talked about it last time about for the county, and that's been brought up before, but maybe different sectors where it can be a collaborated grant writing opportunity, because the last thing we should be doing any year is leaving money on the table that the state or the federal government is offering us. I appreciate the conversation. I'm truly looking forward to the ad hoc committee. I'm just going to put it out there right away because I don't want to wait too long or miss it. I would love to be on that committee. I think this is probably the most important conversation, and this is not a conversation that should ever stop. There is no end to economic development. It should happen every day.
Thank you, Supervisor Spratia. And I want to make just one correction. What we're looking to do is form an ongoing task force with department heads, board members, and all those folks. And it would be a continued conversation. I know they'll go into there. I know you said ad hoc committee a few times, but this is going to be more of a task force situation as we move forward with this. And I just want to start using that name as far as we go forward.
I stand corrected.
Go ahead.
I said I stand corrected.
Yep. Okay, I don't know, any other board members at this time? Supervisor Crandall? Yeah, you're on mute, EJ.
Yeah, I had Dia to put the thing open for me.
There you go.
No, thank you, and I'm actually glad to have this discussion. I appreciate everything that you've all brought forward. I really am glad to hear that the remote work is working out. I don't know if you remember, but during the initial phases of this, I was hoping that, and I knew that this pandemic was putting us into that paradigm shift. And I really felt that that's something that we should be looking into. I do appreciate the devil's advocate play out by Bruno, but at the same time, I like the task force idea because that's where you develop those backup plans for PSPS or anything else that sits in the way of that. Getting people to work from home, I mean, we just have to get away from the old paradigm where, it's almost like the old industrial type of work set where, they want you to punch in at a certain time. They want you to do this. We need to be productivity focused more than anything. And the managers, the directors, or whoever, they've been in these other positions before, so they know the measurements, what it takes to take the production. For example, if you're in social services or behavioral health, you know what amount of time it takes to conduct a specific task, and so you can measure those the same way. I don't know if you guys are familiar with my experience in social services. I've worked, with my tribe. We have a social services program that goes from Modoc County down to San Joaquin. So I've done a lot of work with advocating and I don't know if lobbying is the word, but advocacy is what you were saying. I think someone said something about advocacy and talking to different officials. I have no problem doing that. And actually, I look forward to talking to you, Todd, and I think it was Crystal about getting some of those things. I don't mind doing that. I have experience doing it. So we should talk after, and I would be glad to do things like that for you. That's pretty much all I have, but thank you.
Supervisor Brown? Let's see if you had your hand up or not. Okay. All right, final comments. I want to thank all the department heads that's come through all the workshops, and I will, I want to say this in a respectful way, but Supervisor Sabatier made a comment about investing. It would be secondary for our employees, and I have a different thought on that. Investing in our employees allows us to accomplish our goals and tasks as we move forward for economic development, and I will always have that thought. I've seen great team building. We, as a board, have ideas or directions we'd like to see things going. But I know that each and every one of our department heads and our frontline workers, they do the hard work and pick that up for us. And I've heard from every department head that we've got to make some change. Now, the COVID-19 pandemic has thrown a wrench kind of in everything that we were trying to work on. But I just want to make, that statement that investing in our workforce is investing in our community because they're community members. And as we move along with this task force, I'm just excited about it. Some of the things that we had talked about, as Supervisor Spatier said, when we were back in January, February, we didn't think we could do telework. Well, here we are, we're doing it, and we're hearing reports from most of our department heads that it works in a positive manner, which is all part of us moving forward with economic development and opportunities in our county. Today, we talked about creating a new workforce potentially, all the money that's going out through behavioral health. I think that's an opportunity for us. As far as Department of Social Services, the ability for folks to not have to have a car, to pay for gas, to get back and forth, those are all economic development opportunities. They may be very small, but an extra $200-300 in someone's pocket a month goes a long ways, especially in our community. And anything we can do to help, really grow that in each and every sector in our community, each department, I think is just another opportunity for us. Throughout it, we've heard the theme of, coming into the 21st century as far as automation and technology, which includes online payments or other opportunities. Those are all positive things. But what I've heard from each and every one of our department heads, they might be small steps forward, but we've taken some steps forward since February. So I'm very excited about that. The task force that is going to be created will hopefully help us just zero in on things that we can accomplish over a 12-month period for short-term and then long-term stuff as we move along, so we can really be focused on our approach. I think the board has done a good job also with just some large projects that have come through community development and other places recently that may be a game changer for us in the county. And I want to thank everybody who had, a part and a hand in that. And they are small projects, but each and every project we do during a pandemic puts another eye to look at Lake County as somebody who's willing to move forward, even in the worst of situations that they may be going through. So I'm excited about the opportunity as we move forward with this, and we'll continue to grow in that manner. I know this is kind of tedious to set through these things and talk about this because you guys all have your ideas and would like to see it move forward. But I think this was the proper way to go down the path to get it started, to build a little bit of excitement, really share with each other, what's being done in each department and how we're going to try and move forward as a cohesive unit to make Lake County better and to better each and every one of the people's lives in Lake County. And that's the ultimate goal because they're all friends and family of ours. And if they're not a friend or family, eventually they will be. We'll probably come across all of them. So I really want to thank everyone through this process. I know, data is something that we need to put together, but I'm hoping as the task force is created, we'll be able to answer those questions and really come out with short-term and long-term goals as we move through this process. So thank you very much to all department heads, CAO, everyone that has had a part of putting these 4 workshops together. And then also anyone who's going to be involved as we move forward. And we have a lot of moving parts, but I think getting this thing formed and getting it started immediately or as soon as possible when it's going to be brought back at at our meeting. I know Carol will go into that, but I'm excited and thank you very much for all your hard work. Any more questions from the board? Comments? Supervisor Sabatier?
Will the creation of the task force be brought back to be voted on here as a board, or will that be appointed by the chair?
Carol, I know we had talked about this being agendized, at a later date, which I think was supposed to be in August sometime. That's how we're going to move forward, correct?
Yes, in fact, next Tuesday is August, believe it or not. So yes, I intended to bring forward an agenda item with the chair's recommendation. And we'd be looking to the board to formalize that by motion.
Excellent.
Thank you very much.
Yeah. Okay, any more discussion for the board? We'll be looking to get that back here as soon as possible, Bruno, so we can get moving on it. Okay, no more discussion. We'll go ahead and open it up to public comment. I don't see any hands up. At this point, Jake, can you open the room?
Yes, I will unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close the room. Do we have anybody in the board who would like to make, in the boardroom, who would like to make comment?
It does not appear that there is anybody that wishes to make a comment on this agenda item.
Okay, thank you. All right, we'll bring it back to the board. Basically, we finished it out. What we'll do for direction, I think, is look to get it on an agenda here in the early August, if not next week, the week after, that we can get the task force put together and then move forward, in a quick manner to start have meetings and look at get this thing rolling. All right.
Great, Mr. Chair.
Excellent. All right, thank you very much. Once again, all department heads who gave the workshop. Thank you.
Thank you.
Okay, that concludes this item. We're going to go ahead and move to our supervisors' weekly calendar, travel and reports. Start with Supervisor Sabatier.
All right, I'll be brief. I have a few meetings this afternoon with some of our staff as well as directors to get some answers to some of my questions. Just following up on stuff that's been asked of me from my constituents. Tomorrow I will be meeting with Supervisor Brown and Ms. Hutchinson to review the CARES Act spending plan. Thursday morning, I will be, I guess we've moved the the EOC meetings to Mondays and Thursdays, so I'll be joining that in the morning. On Friday, I have a meeting with the city of Clear Lake for a discussion on the water districts in the city, since none of them are city-owned, and so we're having that discussion. And later on, meeting with Clear Lake as well again to discuss the defaulted properties with the tax collector, and I believe also with Supervisor Brown. And then back here on Monday, and we have a Middle Creek Restoration Project meeting at 10:30, which I will have to make sure and email Public Health that I will be leaving the test site early. And other than that, just working on other projects that I'm working for the county, working on a project that I hope to bring to the board soon, which covers a lot of potential efficiency enhancements and data management for some of our departments. So looking forward to that. That's it for now.
Thank you, Supervisor Crandall. Supervisor Scott?
This afternoon, I have a meeting I'm hoping to attend at 3:30. It's a shelter meeting to discuss the next steps for the shelter that we approved today. Tomorrow, I have meetings from 10 o'clock to 4 o'clock with different departments and entities. Thursday, I'm pretty open. Friday, Saturday, Sunday, I have blocked off to help move the shelter to the juvenile center and help with the clients with paperwork and such, and then back here on Tuesday.
Thank you, Supervisor Scott. Supervisor Crandall?
Yes, I think I have a constituent follow-up today and tomorrow. I've been having an influx of different calls from constituents in the community, many code enforcement issues, and just other follow-up situations, even in, dealing with problems with their projects that they submitted to like community development, things like that. So I've been trying to follow up with these folks, and I'm doing that Wednesday, Thursday, and in essence Friday. And if something else falls in, or if there's something I can attend, I will. But I'm trying to catch up on a lot of those because I have many of them. So anyhow, Monday, Middle Creek Restoration, 10:30, Code Recovery Group, 12, and then the CAO meeting at 3, and then I'll be back there Tuesday.
Supervisor Brown?
So I have the meetings that Bruno talked about, and then Thursday I'm meeting with Scott DeLeon, and Friday with Andrew Williams from Code Enforcement.
Hey, thank you very much. I got the agenda review after today's meeting. I was moving through that Wednesday and Thursday. We're doing the same thing. There are a lot of phone calls going on right now, different industries that are either starting up or want to start up. So we're following up on those phone calls. And then, Wednesday afternoon, have a late afternoon medical appointment I'll be attending. Thursday morning, we're doing the EOC call also, since we changed. On Friday, don't have anything at this point. We're back here on Tuesday for the meeting next week. So ultimately, that concludes our agenda for today. On the regular agenda, we're going to go into closed session. We have 2 items. Those 2 items are 8.1, conference with legal counsel, existing litigation pursuant to Government Code, Section 54956.9. John ETL versus Lake County of Lake, conference with legal counsel, existing litigation pursuant to Section Gorgie versus County of Lake. And so those are our 2 items, 8.1 and 8.2 for closed session. With that, we'll go into closed session.